منك الجد. اللهم إنا نستغفرك بعلمك ونستقدرك بقدرتك ونسألك من فضلك العظيم، فإنك تقدر ولا أقدر وتعلم ولا نعلم وأنت علام الغيوب. السلام عليكم ورحمة الله وبركاته.
Yeah, thank you so much. I will not interpret. You can talk to your neighbor that really you have heard the man pray. Thank you so much. May I therefore invite the chairperson of the judge to address us as we start the day. I thank you.
Yeah, God is good and all the time. So I welcome everyone to this beautiful Saturday morning. It's indeed a great privilege for all of us to be here on these grounds. A few things that I just need to put across. First, I want to thank all people who participated in yesterday's quiz challenge. I congratulate you all. Secondly, all your concerns that were raised yesterday to our table are being attended to. We are reviewing every concern to the detail, and we will communicate our final decisions when you come back from the break, because we are straight away going to the serious business. And then when you break for your short break, when you come back, you'll find all the decisions here. Secondly, we suggest that after your presentation here, your concerns should be brought to the table of judges immediately, if at all you need them to be addressed. If you bring it later than your set, we will not receive it. Yes? Yeah, so we pray that that will help us actually to move a little bit faster, and we will be able to attend to all concerns as they are coming. I have a fully constituted table here of the judges. We have 5 of us on the bench here, and we believe we shall be able to decisively vote on some things that bring conflict. And our humble prayer is that you take it in good faith. You know, always when you go to court, there is usually a winner and a loser. So it's not obvious that when you bring a concern that is maybe controversial like that, you will always be winning. No, we are here to give guidance. And we pray that whatever decisions we are going to take, you take them in good faith. Okay? Yeah. So if we go by that, I really believe we shall be here in peace, and we shall live in peace. And peace almost is the utmost thing that every man or every person desires in every situation. I already see peace prevailing amidst us. So let's promote that peace, and let's promote it up to the end, even after here. This is not our end. We shall always be meeting, shall always be crossing path everywhere, every now and then. Now, this is to all of us in the house. In addition to the rules we have for the presenters, we shall be having 2 groups at a go. The quizmaster will call out the first group and the second group. The second group will sit on the other side, on my right, where I'm pointing, and then the first group will be here on stage. So when you come on stage, we suggest that all communication from the audience to the participants is cut off. We wish not to hear any murmurs or communication from the audience. Whatever question that the only chance that you have is that you're able to view the question. Whether you know the answer or you don't know, please leave it to the participants who are on stage. Yes? The best you can do is just pray internally and your answers are transmitted to the participants. Okay? Which I think is very possible. Yeah, so just pray silently and please don't say anything aloud. We will take very decisive and drastic decisions on anything that we hear from the audience. Just bear that in mind, which will not be in your favor, please. So don't take us to that stage. We don't want to go to that stage, okay? But if need be, we shall go there. But for now, let's have peace prevail amongst us. And we trust that the people that are on stage here, can I say brighter than all of us who are behind here? Yes? So let's not insult them by giving them answers. For me, when you're on stage here, you are the brightest than anyone in the house. Okay? Yeah. So in addition to that, once you come on stage here and you're done to answer the questions, please face the screen. We're seeing some irregularities yesterday where some members would probably face the audience, and we cannot rule out the fact that some people are very good in sign language. Yes? So somebody has already inserted the question into a AI or meta AI and is telling you A. Yes? Another one saying it's B. Another one saying this. So you put the rest of the participants to a disadvantage. Yes? You stand a higher advantage than the others. You get it? Some have already programmed themselves like this is A, this is B, this is C. So when the answer is there, somebody, okay, A. You get it? So all those things have actually come to our attention, and we are just to let you know that we shall be very keen and very observant on that. Please, when you come on stage, face only the screen. The rest of us, we just read in silence and observe. I hope that is clear. Okay. Any movement of other people around the quiz master or where the questions are being programmed to be set is out of bound. If maybe you're taking some pictures or on the top, I will request that maybe you change the location where you'll be coming from and not necessarily on this side, because we feel we want to exercise the highest level of integrity as much as possible, okay? Where everybody is confident of the process. For us as judges, we know that nothing has leaked out. But if we see a lot of movements in and out or whatever around this area, we suspect that maybe something is going on, okay? And the participants, other participants will, of course, start doubting the credibility of the exercise. Yeah, so that said, I think we are good to go. I don't know if anybody has any question to me, one or two? Yes. Okay, thank you. So maybe some more clarification. You have another question? Yes? Okay. All right, thank you. Yes? Yeah, I get your concern. Okay, fine. I think that has been taken care of. It's loud and clear. Okay, let me just start by responding to the first person who raised a concern. When you're coming to bring your concern, it's a written note. You may not need to put more clarification because you've written it down. So if you just move in like this and hand over, we are here to receive. There's, I think our position here is a bit strategic. You may not get lost and move to the other side and then come back to us. Okay, that's fine. On the issue of the questions being shifted, questions being shifted, the quizmaster is going to announce the order that they're going to follow this morning. Yes, and then we shall follow that. So we will go with their order. And secondly, on the issue of the question papers to be tossed first before people pick the chances, that one's quite easy. We shall adjust to that faster. So when you are called upon as team leaders, please move forward quickly. And when you are all present, then you can probably struggle to pick the best. Yeah, so you'll struggle to pick your best. Huh? Okay. On answers being projected, yes, we also noted that yesterday, but we got a technical glimpse on the projection, and we're somehow rigid to involve other ITs to come and rectify that. So we're sorry, we are going to try to go manual, but we shall try to be as accurate as possible. So we have had a meeting where we have actually we've done a recap of the day's proceedings, and we trying to address them. So hopefully we had a learning yesterday, and today is going to be the best. So let's minimize the questions. I don't know if there's really so much burning, we would actually set the ball rolling. Oh, the gentleman. Okay, yeah, I take your concern. I take it seriously. Now, yesterday, one, I wish you'd moved forward to us earlier on before maybe you raise this, then we give you the real thing. Probably why people are getting that anxious, yesterday, the questions that we had planned to cover, we could not cover them. You get it? Now, given the learnings of yesterday that we covered 3, how sure are we that we may cover 10? To be realistic. So now, given that fact, we the judges were going to take a decision that let's have these course units covered, unless we plan to extend our days here to next week. So let's be calm. We appreciate the effort actually you people have taken to prepare for this. Some people started preparing a semester ago, yes? And they've been having days and nights of reading amidst other assignments. So we've not made a very big shift. definitely one or two may be left out. Just prepare your mind, which is beyond my control and your control. Yes, because yesterday we had a very late takeoff time. So maybe we have to redeem some minutes and we have the ball rolling, if that helps us all. Thank you. In case you have anything burning that I have not answered, kindly put it down. We shall chip in. Kindly put it down, then bring it here. Thank you. So I hand over to the quiz master, and the quiz master, please try to redeem some minutes or some seconds where necessary, and we move a little bit fast. Thank you.
Okay, thank you so much, Chief Judge. That was a very wonderful clarification and also information that people really needed at the right time. So people had so many complaints, but I hope by the time we leave this place, they will all be addressed. So I want to welcome you all back to this second day of our annual quiz. And let's not forget that we are not here only to test your knowledge, but to appreciate and also celebrate the kind of things that you do each and every day. We all understand that you've put in a lot of time in preparing for this quiz, and we appreciate that, and we just pray that all that pays off. So for today's program, we've decided to take on only 6 course units, and that is, this is the order. The first one is biochemistry. The second one is medical surgical nursing. Then we have midwifery, third, gynecology, emergency care, and pediatrics. So that is the order. At this point in time, I want to invite the representatives from every team to come and pick their numbers for the first course unit, and that's biochemistry. Let's try to be very fast. Okay. 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 Do we have all the 11 teams here? We can push back a little bit so that we can have some space. Struggle for the fittest, eh? Okay. So I hope we all have the 11 people here, right? Okay. We're supposed to be 11 teams. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Okay. Let's first choose the team for the first course unit. Make sure to come and you register one by one. One by one. So who has team number 1? Who has team number 1? Which university? So Lira University, prepare to come on the floor. You can come so we can start verifying you. And which is team number 2? And Moni University, come forward for verification. So number 2 down, number 1 come up. Thank you. Bring our papers back. First write your letter. Lira University, come to our table for verification. And Moni University, you can go to our right. Biochemistry. Make sure you leave the paper behind. Okay, those who have written. So this is team one. You can come for verification. Okay, so as you come for verification, make sure you come with your ID or your portal for verification. Kindly, let's try to adhere to the rules of the game. What else? Lira University.
What's your opinion? Should they bring chairs and sit? Because they're not reading from down, so we put chairs facing that way. Put chairs facing that side. Is it okay?
And they discuss one seated. Like one behind. They will stand. They'll stand.
So the others are complaining that they're not able to see the questions. They're blocked.
It's only these people who need to see them. So, Team Lira, you can take the floor. Let's welcome Team Lira. Okay, so you can remove this. So, like you've been told, we shall only face the screen. You're not supposed to face the congregation. When someone turns, we are disqualifying that question. It's a 0 for that question. Okay, so Team Lira, are you ready? We can can have the projection of the questions.
Are we introducing ourselves or?
They've already been verified. So, same rules as yesterday. You will only have 60 seconds to answer every question, and you'll get a reminder 10 seconds to the end of your time. So, make sure you discuss amongst you before giving your answer. Okay. We are starting with biochemistry, and this is the team from Lira University. We're getting. In the meantime, the team from MAST should also be preparing. Are we ready? Okay. So, question 1. Which of the following amino acids is essential?
The answer is C.
Correct. Question 2. Which molecule activates PFK1?
Our answer is C.
Correct. Question number 3. Gluconeogenesis mainly occurs in the
Our answer is C.
Correct. Question number 4. Okay. The Lineweaver-Burke plot of a competitive inhibitor will show.
Our answer is A.
The correct answer is B. Question 5. The transition state theory of enzyme catalysis implies
Our answer is A.
the correct answer is C. Thank you so much, the team from Lira. A round of applause for the team from Lira. Okay, so the next team get on the stage. That is team Moni University. Okay, let's welcome the team from Moni University. In the meantime, must should go to the table on our right for verification. Team from Cabar University, you can come forward for verification. So take your positions. Take your positions. Okay. Moni University, are we ready? Yes. Okay, so we are here for biochemistry. Five questions, 60 seconds, and you have a 10 seconds reminder. Are we together? Okay, so question 1. The primary structure of a protein is determined by
B.
Correct. Question number 2. The net gain of ATP from anaerobic glycolysis per glucose molecule is?
B.
Correct. Question number 3. Question number 3. The Cori cycle links which two organs?
C.
Correct. Question number 4. Which of the following amino acids in the active site is most commonly involved in the covalent catalysis?
C.
No, the correct answer is A. Question number 5. Please face the side. Which complex of the electron transport chain directly reduces oxygen?
C.
Correct. Thank you so much. The team from Mune University. Let's give them a round of applause. The team from Cabar University, you can take the floor. In the meantime, Victoria University, you can come forward for verification. Victoria University, please step forward for verification. Okay. Mbara University, are you ready? Face this side. Okay. 5 questions for you, 6 seconds for every question, and you'll get a reminder 10 seconds to the end of your time. Question 1. Which enzyme catalyzes the conversion of glucose to glucose 6-phosphate in the liver?
The answer is B.
Correct. Question 2. Which pathway generates NADPH?
The answer is C.
Correct. Question number 3. The alpha helix structure is stabilized by? Please, don't look back.
The answer is B.
Correct. Question number 4. No looking back again, please. Which vitamin is needed for lipid digestion?
The answer is D.
Correct. Question number 5. Uncouplers such as the 2,4-DNP.
The answer is B.
No, the correct answer is D. Thank you so much, the team from Cabar University. Let's give them a round of applause. Okay, in the meantime, let's have Victoria University, and then Busitema should come for verification. Victoria University on the floor. Busitema University, come forward for verification. Okay. Victoria University, are you ready? Are we ready?
Yes.
Okay, same rules. 60 seconds for every question, and you'll get 5 questions. Question 1. Which sugar is a disaccharide?
B.
No, the correct answer is C. Question number 2. In anaerobic respiration, pyruvate is converted into
D.
No, the correct answer is C. Question number 3. Which enzyme is responsible for breaking down glycogen in muscle?
B.
Correct. Question number 4. Fatty acid synthesis occurs in Can we have total silence, please?
C.
Correct. Question number 5. What effect does cyanide have on oxidative phosphorylation?
B.
No, the correct answer is C. Thank you so much, the team from Victoria University. Let's give them a round of applause. Just a caution, let's try as much as we can to be very, very quiet when our colleagues are on the floor. Are we together? Okay, so we have the next team on stage, and that is Busitema University. Please take the floor. In the meantime, Makerere University, you should prepare for verification. Okay, take the microphone. Busitema University. Forward. Can we face forward? 60 seconds for every question, and you have 5 questions. Question 1. Which form of glucose is most predominant in solution?
We are going with B.
No, the correct answer is C. Question 2. The rate limiting step of glycolysis is catalyzed by?
We are going with C.
Correct. Question number 3. Von Gogh disease is a disease of?
We are going with B.
Correct. Question number 4. Which lipoprotein is considered bad cholesterol? No looking back, please.
We are going with B.
Correct. No looking back, please. Question number 5. Carbohydrate metabolism, deeper pathways. The glucose transport most responsible to insulin is?
We are going with D.
Correct. Thank you so much, the team from Busitema. Okay. Yes, it's going to be a very tight and very interesting race. Don't forget to have fun. Eh? Okay, Makerere University on the floor. In the meantime, IU should prepare for verification. IU, come forward for verification. Please, we want to re-echo this. When you come here, no looking back. Are we together? No looking backwards. Okay. Makerere University, are you ready? So let's wait for the projection. Just like the other teams, you have 60 seconds for every question, and you'll get a total of 5 questions. You'll get a reminder, 10 seconds to the end of your time. So make sure you discuss amongst you, then you can give your answer. Are you ready? Okay. Are we ready? Okay, Makerere University. Question 1. Which of the following is a non-reducing sugar?
Sucrose.
No, the correct answer is A. Question number 2. Sorry for that. There's a clarification on that. Correct. Okay, question number 2. Which enzyme is deficient in classic galactosemia?
D.
The correct answer is B. Okay, question number 3. Which intermediate links glycolysis and the TCA cycle?
C.
Correct. Question number 4. Acetyl-CoA carboxylase requires
A.
correct. Question number 5. In hereditary fructose intolerance, accumulation of which compound leads to hypoglycemia?
A.
Correct. Thank you so much, Makerere University. Yes, let's welcome back Makerere University. In the meantime, IU, get on the floor. So, Sorati University, you can come forward for verification. Sorati University, please step forward for verification. Okay. Are you ready? So you have 5 questions, 60 seconds to answer each, and you will have 10 seconds reminder to the end of your time. Question 1. Which lipid is amphipathic?
Our answer is C.
Correct. Question number 2. Isoenzymes differ in? Can you try to be quiet?
Our answer is C.
Correct. Question number 3. Pyruvate dehydrogenase complex requires how many factors?
Our answer is D.
Correct. Question number 4. Which fatty acid is essential?
Our answer is B.
Correct. Question number 5. Why does alcohol consumption exacerbate hypoglycemia in fasting?
Our answer is C.
Correct. Thank you so much, the team from IU. Let's have the next team from Sorati University take up the floor. Sorati University. The team from BSU should be ready in the meantime. Team from BSU, you should come forward for verification. Okay, Sorati University. Are you ready? So you have five questions. 60 seconds to answer each question. Okay, just a point of information. We are kindly requesting the participants from the universities that have completed to go for breakfast so that we can be able to resume when they get back here. Oh, one at a go. The first one was Lira University should go for breakfast. And then after that, we shall go to Moni University. Okay, Soroti University, are you ready? 60 seconds for each question, 10 seconds reminder. Question 1. Cholesterol is a precursor for? B. Correct. Question number 2. Deficiency of which vitamin leads to lactic acidosis? A. No, the correct answer is B. Question number 3. Which of the following is not a product of the TCA cycle? D. Correct. Question number 4. Familial hypercholesterolemia is due to? B. B. Okay, correct. Question number 5. Which intermediate of glycolysis is used in the synthesis of triglycerides? D. Correct. Let's welcome Sorati University. Thank you so much, Sorati University. Okay, now we have the team from BSU. BSU, come to the floor. In the meantime, we should have Agakhan come forward for verification. Team Agakhan, please step forward for verification. BSU, our hosts, we're grateful. Okay, are you ready? Are you ready?
Yes.
Can you step backwards a bit? Just backwards a bit and step forward, face forward. Okay, BSU, you have 5 questions, 60 seconds for each question, and you get a 10-second reminder. Okay, question 1. Nucleotides contain
The answer is B.
correct. Question number 2. Enzymes that use NAD or NADP are usually
The answer is C.
correct. Question number 3. Which enzyme catalyzes the final step of the electron transport chain?
The answer is B.
Correct. Question number 4. Which apolipoprotein is required for cyclomicron clearance?
We go with D.
No, the correct answer is C. Question number 5. Anaplerotic reactions.
We go with C.
Correct. Thank you so much. The team from BSU. Yes, a round of applause for BSU. Let's welcome the next team. That's Agakhan on the floor. In the meantime, Cabar University, you should come forward for verification. Cabar University, please step forward for verification. Okay, Agakhan, are you ready? Okay, 5 questions, 60 seconds each. And you'll get a 10 seconds reminder at the end of before the end of your time. Okay, question 1. Which nitrogenous base is found only in RNA?
Answer is C, uracil.
Correct. Question number 2. Feedback inhibition is? Can you try to be quiet, please?
C.
Correct. Question number 3. Question number 3. Question number 3. Beta oxidation occurs in the?
A.
No, the correct answer is B. Question number 4. Lipoprotein lipase acts on?
A.
No, the correct answer is B. Question number 5. Which of the following enzymes is regulated by phosphorylation during fasting? Let's not look backwards.
C.
Correct. Thank you so much. The team from Agakhan. A round of applause for Agakhan. Okay. Let's have the last group on the stage for this question unit. And that's Cabar University. Let's welcome Cabar University. Okay. Cabar University, 5 questions. Are you ready? Okay. 60 seconds for each question, and you'll get a reminder 10 seconds to the end of your time. Make sure you discuss before giving your answer. Okay. Question 1. Enzymes.
Our answer is B.
Correct. Question number 2. Allosteric enzymes.
Our answer is D.
The correct answer is B. Okay, question number 3. The enzyme carnitine acetyltransferase is inhibited by?
Our answer is B.
Correct. Question number 4. The key rate limiting enzyme of cholesterol synthesis is? Just make sure to face forward.
Our answer is B.
Correct. Question number 5. The enzyme responsible for activation of fatty acids for oxidation is?
The final answer is C.
No, the correct answer is B. Thank you so much, the team from Cabar University. Okay. Very tight and very interesting. So we are going to be having a working tea. I expect the first team to be back in the tent for the next set of questions. So we are going for medical nursing, medical surgical nursing. We expect all teams to get back to the tent, and we have a working tea. So if you've picked your tea or your breakfast, kindly move to the tent so we can proceed. All those that have picked their breakfast, move to the tent, and then we can have a working tea.
Hello, members. I do appreciate the process, and I know you're all feeling it. Is it moving smoothly? Is it well? Yeah. The pressure is high. It's decreasing. Thank you. Thank you for appreciating. We have two issues to respond to in regards to the just concluded set round of biochemistry. For set 8, that is Sorati University, the question that has just been flashed here, I believe we've all seen it. There's a contest on the answer, and to us here, they have the point. Yeah, thank you. So the answer is vitamin B1, that is thiamine. Yeah, we all agree? Thank you. Then there was a concern about emergency care. We all appreciate that at our level as bachelor nurses, we all experience emergencies, and it's part and parcel of us. Actually, emergency care is embedded in all course units that we do. In pediatrics, medicine, gyne, there is no course unit without an emergency component. So therefore, we will have to do it. There are some universities that say they don't offer emergency care, but we all appreciate. What we have here is the overall knowledge and placing. There is nothing like we do not experience or we do not do emergency as in a course unit. Thank you. Thank you. Is that in response to this? Well, I may not allow you to speak because this is a general consensus of all the 5 judges, and the ruling cannot be overturned. There's no appeal. We have had an extensive discussion of all the 5 judges, and that's what they have come up to. Okay? Thank you.
Okay.
Excuse me, members. This is an announcement. For those who are taking a tea, we are taking a tea from here. You go, you pick the tea, you come and take as we continue. Because you understand we are already out of time. So we don't have time to break up for tea. We are so sorry for that, but we beg you take it. Thank you.
Okay, thank you so much for that information. So all participants, all teams, please move back to the tent, and we continue with the next session. So I invite the representatives from the different teams to come and pick the numbers. Can I have the representatives from every team? Yes? If your team is still out, please send a representative to pick your number. Can I have the representatives from the different teams? If you're seated outside, kindly come into the tent. We are going to be having a working tea. So the first team should be ready to start. Okay, I need 11 members. Okay. How come I have two left? It has to be. One by one, eh? Right. Which team is number one? IU. Prepare to come first for this first set of questions. Which team is number two? And Moni University should also prepare to come on the floor. So are you number one and then Moni University? Make sure you leave our papers behind. Yeah, it's that one. Okay, team number one, you can come forward for verification. And team number two, come forward for verification. Remember, we are going for medical, surgical, nursing. Are we together? One of the cores of the nursing profession. So we have IU, Moni University, and in the third place we have Makerere University. So make sure you're ready. Anyone who is still out, kindly get back to the tent so that we can proceed with our program. Any person who is still outside, kindly make your way to the tent. Very tight, very interesting. The first team, come to this table, please. For verification, come to this table. Oh, okay, so we have team number one for the first set of questions. Medical surgical nursing. Okay, so medical surgical nursing is structured. Get ready to have some fun. Get ready to have some fun. Maybe just a point to clarify. If you have any concern about any question, before you leave the stage, one of you should pass here and register your concern. So one of the team members will pass via the judge's team and they will register their concern. If you know that you're still seated outside, kindly get into the tent. Okay. So are you ready? Same rules. 60 seconds to answer every question. This time round, a structured question. 60 seconds to answer the question, and you'll get a reminder 10 seconds to the end of your time. So, make sure you discuss amongst you and come up with your answer. Okay, are we ready? Medical surgical nursing. Question 1. What is the most common cause of pneumonia in adults?
Well, we choose bacteria. In terms of bacteria and strep pneumonia in particular.
Correct. Question number 2. Mention at least 2 nursing interventions for chronic kidney disease.
Educate on diet. So first we monitor fluid input and output, educate the patient on dietary requirements, and then monitor blood pressure.
So the answers we have, we monitor the weight, fluid balance, restriction of sodium potassium intake as advised. Correct. Okay, we shall leave the judges to agree on that. Is it correct?
They have one correct answer. Yes. No, it is 412.
This man, there is one incorrect
Hello, members.
No.
The brief interaction I've had with the judges around here, they get 1 point and they fail the other. To be specific, specific management of chronic kidney disease is what they have just stated. When they talk about salt restriction, very important and very key. um, um, water restriction, and wait, get it. So here we are speaking about the specific management of CKD.
But the question doesn't say specific.
Yes. Yes, what would you take as your top priority in nursing?
But you say that list two. The question
Okay,
says
so
that
let's proceed.
at least two.
So, members, let's not discuss. In adult education, all answers are correct, right? Yes, all answers are correct. There is no wrong answer, but what is the most correct answer is what we want. You will also come on stage and we shall do the same ruling. Okay, let's move.
Okay, so that's 1 mark out of 2.
Do you want us to repeat the answers? You said we gave three
Let's
answers.
first complete the quiz. You can
Actually, we
register your
gave three.
concerns later. Question number 3. A patient post-stroke is unable to swallow. What is your priority nursing diagnosis? Sorry, priority nursing intervention.
Our priority nursing intervention would be insertion of an NG tube to ensure nutritional balance.
The question we have is keep patient nothing per oral and refer to a speech therapist for a swallow assessment. Question number 4. A patient with a seizure disorder collapses. What is the first nursing action?
The first action do is clearing or making sure that the environment around is safe for the patient, like removing any harmful objects.
Okay, the correct answer we have here is protect the airway, turn the patient to the side, and do not restrain. Question number 5. You can project. Okay, so we resume. IU, your last question. Question number 5. What is the nursing care for a patient with Parkinson's disease? Mention at least one.
Administer drugs as prescribed and ensure a safe environment for this patient.
Okay, the answer we have is assist with mobility, administer medication such as levodopa, and prevent falls. That is correct. Thank you so much, the team from IU. Let's have the next team on stage. And that is Muni University. Let's welcome Muni University on the stage. Makerere University, kindly move forward for verification. Okay, Muni University, are you ready?
Yes, we're ready.
Okay. So we have 5 questions for you. Question number 1. Question number 1. Mention at least 2 key nursing interventions for an adult with pneumonia. Kindly make a line and face forward. Kindly face forward. Participants, kindly make a line and face forward.
So we shall first begin by, our answers are, 1, we will position the patient in high Fowler's position to ensure maximum chest expansion. Then the second one, we shall administer oxygen as prescribed. Then we also have administering antibiotics as prescribed after identifying the cause of the pneumonia.
Okay, the answer we have is monitor respiratory rate, monitor oxygen saturation, administer oxygen therapy, and administer prescribed antibiotics. So correct. Question number 2. What is chronic kidney disease?
We are defining chronic kidney disease as a progressive, irreversible decline in renal function.
The correct answer we have, progressive loss of kidney function over months or years. Was there a concept of time in there? Okay. So I did that. So it has been considered wrong. Question number 3. A patient complains of chest pain radiating to the left arm. What is the nurse's presumptive diagnosis? Can we be quiet, please?
Our answer is angina pectoralis.
Correct. Question number 4. What is the immediate intervention for angina pectoris in the patient above?
Our answer is to administer nitroglycerin as prescribed to aid in vasodilation.
The correct answer is administer nitroglycerin as prescribed and monitor ECG. Correct. Question number 5. What should be monitored in a patient on furosemide for heart failure? At least one parameter.
Our answers are heart rate, urine output, then blood pressure.
The answers we have, one is potassium levels, urine output, and signs of dehydration. Correct. Thank you so much, the team from Moni University. Let's welcome Makerere University on the floor. We had potassium levels, urine output, and then urine. The last of dehydration, signs of dehydration. And what did one? What did one? Makerere University. Okay, Makerere University. 5 questions. Medical surgical nursing. 60 seconds each question, and you'll get a reminder, 10 seconds to the end of your time. Question 1. What is a key symptom of chronic obstructive pulmonary disease? Lira University.
Barrel chest, tripod position.
The answers we have are persistent cough with sputum and shortness of breath. That's wrong. So question number 2. Question number 2. What is anemia?
So anemia is described as reduced number of red blood cells below than normal and reduced concentration of hemoglobin below than normal.
Okay, the answer we have is, okay, reduced blood hemoglobin below the threshold to carry sufficient oxygen to tissues. Correct. Question number 3. Question number 3. Mention at least 2 nursing interventions for anemia in adults.
Okay, we are going to maintain diet of iron-rich foods, for example, hibiscus, and then we are going to administer or give prescribed blood products as prescribed, and put the patient on oxygen as prescribed by the doctor in severe cases.
Okay, so we have monitor fatigue, provide iron-rich foods, and administer iron supplements. Correct. Question number 4. A patient is coughing up blood-stained sputum. What condition should you suspect and report?
Pulmonary tuberculosis.
Correct. Question number 5. What discharge advice should be given to a patient recovering from acute bronchitis?
Okay, the patient should avoid triggers, for example, smoke, and they should take the medication as prescribed and adhere to it.
Okay, the correct answer is avoid smoking, stay hydrated, and complete antibiotics and rest. Correct. Thank you so much, Makerere University. Let's welcome the next team on floor, and that is Lira University. Welcome, Lira University. In the meantime, Sorati University should be getting ready, and they should come forward for verification. So, Lira University, are you ready? 5 questions, 60 seconds each. Are we ready? Question 1. Mention at least 2 nursing interventions for an adult hypertensive condition. Can we be quiet, please?
Here we can look at monitoring of vital signs like blood pressure and pulse. Then we can look at administering antihypertensives as prescribed, like some diuretics. Then we can look at monitoring the fluid intake and output, then and balancing them on the fluid balance chart.
The correct answer we have is educate on low salt diet, medication adherence, and regular monitoring of blood pressure. Correct. Question number 2. What is hemophilia?
Hemophilia is an autosomal recessive X-linked condition where we have characterized by deficiency of clotting factors like factor 8 and 9. And we are looking at, there is the delayed clotting in it.
The correct answer is a genetic disorder causing deficiency of clotting factors and thus uncontrolled bleeding. Correct. Question number 3. Mention at least one nursing intervention for a hemophilic patient.
Here we can look at one, we can health educate the patient on the disastrous injuries to prevent themselves from getting injuries, because we have the risk of increased bleeding. Then we can administer medications as prescribed by the physician, like blood contents like okay, we can blood contents like blood products.
Okay, so the correct answer we have is prevent injuries, apply pressure to bleeding sites, and monitor factor replacement therapy. So, correct. Question number 4. A patient with uncontrolled diabetes presents with a fruity smelling breath and deep breathing. What is the biochemical explanation?
So when we look at uncontrolled diabetes, here when we talk about diabetes, we are looking at the patient can be having diabetes type 1 or type 2, whereby we have decreased entry of glucose into cells. When you have decreased entry of glucose into the cells will get hungry, hence stimulating production of stress hormones. These stress hormones like cortisol will increase gluconeogenesis. Here in gluconeogenesis, we shall have increased blood sugar levels, hyperglycemia. And if we have increased hyperglycemia, can have hyperosmolarity. That hyperosmolarity will lead to pulling of water from the cells into the vesicular space. And that pulling of blood fluids from cells to vesicular space
Okay, so we are back. So one question left for the team from Lira University. The answer was wrong. The correct answer was diabetic ketoacidosis.
Biochemical experience.
So the last question for the team from Lira University is it? Okay, are you ready? So for your last question? Okay. Let's try to be very quiet to give our participants time to think and get to the right answer. Okay. Question number 5. But don't start from 5. What's the problem? Hmm? Okay.
So for question 4, the answer they have is the patient is in diabetic ketoacidosis or DKA. The explanation, the right explanation is due to lack of insulin, fat breakdown increases, producing ketone bodies, e.g. acetone, causes metabolic acidosis. The right answer was mainly DKA.
They're declaring themselves winners before we finish. But we're taking forever, honestly. Chechiganyi banna. Okay, question number 5. A patient with pneumonia has a respiratory rate of 32 per minute, an SpO2 of 88%. What should the nurse do first?
Here, we put the patient in a sit-up position and we administer oxygen therapy as prescribed.
Okay. Administer or supplement oxygen and inform a physician. Correct. Okay. Thank you so much, the team from Lira University. Let's welcome the next team on stage, and that is Sorati University. In the meantime, Cabar University should get forward for verification. Okay. Sorati University, are you ready?
Yep.
Okay. You have 5 questions. Question number 1. Mention at least 2 nursing interventions for an adult with myocardial infarction.
We monitor the ECG, administer prescribed drugs like cardiac aspirin, and then monitoring vitals.
So the correct answer, monitor ECG, administer oxygen, administer nitroglycerin, aspirin, and any other prescribed drugs. Correct. Question number 2. What is diabetes mellitus?
It is a metabolic disorder characterized by increase in the blood glucose levels caused due to either decreased sensitivity to insulin or deficiency in the production of insulin.
Okay, the correct answer, monitor a disorder of insulin production or use leading to high blood glucose levels. Correct. Question number 3. Mention at least 1 nursing intervention for diabetes mellitus.
Health education on the patient's dietary measures, 1. 2, monitoring blood glucose levels. 3, monitoring vitals. And then educate the patient on adhesion to prescribed medications, and then administer prescribed medications.
Okay.
Like insulin.
Monitor blood glucose, educate on insulin use, and educate on diet management. Correct. Question number 4. What is the primary symptom of myasthenia gravis? Can we try to be very quiet? And let's face the screen, participants. Let's face the screen, please.
Muscle weakness and pain in the muscles.
The correct answer is muscle weakness that worsens with activity. Any condition can have. Wrong. Question number 5. How do you assess for malnutrition during a patient examination?
For assessment of malnutrition, we shall use anthropometric measurements, where you do weight, height, mark, and then we shall do biochemical tests, where you do like stool analysis, CBS, and all that, and then we shall do clinical assessment, where you do edema, wasting, and all that, and then there is dietary, where you do the 24-hour history, you do the frequency of the meals, and then the dietary diary.
Correct. Okay. Thank you so much, Team Soroti. Let's welcome the next team on stage, and that is the team from Cabar University. Cabar University, please stand in a line and face the screen. And let's try to be very quiet as they answer the questions. Okay. Cabar University, are you ready? 5 questions, 60 seconds each, and you'll get a reminder 10 seconds to the end of your time. Okay, question number 1. What is the main complication of untreated myocardial infarction? Can we be quiet, please? Can we be quiet, please? Cabaret team.
Yeah, we think our answer is myocardial ischemia that will lead to hypertrophy.
The correct answer is heart failure or cardiac arrest. Thank you. Victoria University, come for verification. The next question. What is hyperthyroidism? Can we try to be very quiet, please? The team at the back.
Okay, we can define it as a condition characterized by increased secretion of thyroid hormones, for example, mostly, especially T3 and T4.
Correct. Question number 3. Mention at least 2 nursing interventions for hyperthyroidism.
Okay, we can look at monitoring weight, administering medication that's prescribed, and also monitoring BMI, and health education of the patient on the diet.
The correct answer is monitor heart rate, weight, and temperature, and then administer antithyroid drugs. So,
we talked of them.
So 1 mark out of 2. Question number 4. A nursing mother has cracked lips, sore tongue, and dry skin. Which vitamin deficiency is this likely to be?
Vitamin B3.
No, the correct answer is vitamin B2 deficiency. Question number 5. A patient on long-term alcohol use develops confusion, poor coordination, and memory loss. What deficiency is suspected?
Magnesium.
The correct answer is thiamine. Thank you so much, the team from Cabar University. Let's clap for them. And welcome the next team on stage, and that is Victoria University. At the same time, Agakhan, please step forward for verification. Let's welcome the team from Victoria University. Okay, so Victoria University, are you ready? 5 questions, 60 seconds per question, and you'll get a reminder, 10 seconds to the end of your time. Question number 1. Mention at least one early sign of a stroke.
face dropping, arms weakness, slurred speech, and time.
Okay. Facial dropping, arm weakness, and slurred speech. Correct. Before you go to the next. Question number 2. What is peptic ulcer disease?
Peptic ulcer disease is a condition characterized by the erosion of the inner lining of the stomach.
Okay, the answer we have is ulceration of the stomach or duodenal lining due to H. pylori or NSAIDs. Wrong. Question number 3. Mention at least 2 nursing interventions for peptic ulcer disease.
Two interventions for peptic ulcer. One, to administer prescribed anti-peptic, for example, antacids, and also health educations on diet modifications.
Correct answer is educate on avoiding spicy foods, frequent meals, administer antacids, proton pump inhibitors, histamine receptor blockers, and then antibiotics. So they mentioned all. All. They mentioned all. Correct. Next question. What key vitamin is required for calcium absorption?
The answer is vitamin D.
Correct. Question number 5. What disease results from the deficiency of vitamin D in adults?
Osteoporosis.
The correct answer is osteomalacia in adults and rickets in children. Okay, thank you so much, the team from Victoria University. So we shall have now team from Agakhan. At the same time, let's have the team from Busitema University.
To this side.
Thank you. So the team from Busitema, come forward for verification. Okay, Agakhan, are you ready? Question number 1. Mention at least 2 nursing interventions for stroke, especially.
We'll start by monitoring vitals, respiratory rate, blood pressure. We will administer prescribed medication. Physiotherapy. Rehabilitation like physiotherapy, speech therapy, and also to teach attendants on how to do the physiotherapy while at home, especially on speech and eating.
Okay, the correct answer is perform a quick neurological assessment and prepare for emergency referral. Wrong. Question number 2. Which genotype of hepatitis may cause epidemic outbreaks and therefore require strict infection control measures? Can we try to be very quiet, please? Can we have total silence, please?
hepatitis B?
No, the correct answer is hepatitis A and E. Question number 3. Which genotypes of hepatitis are associated with chronic liver infection, cirrhosis, and liver cancer?
B and C.
Correct. Next question, please. It's right there.
A quick change. Question 4 and 5 of this slide, of this set, have issues. We've moved to, we are going to do number 1 and number 3 of the slide set 9, which was not chosen. Thank you.
Okay, question number 4. What is epilepsy?
Epilepsy is a neurological disease characterized by abdominal electrical transmission, mostly seen as seizures.
A neurological disorder characterized by recurrent seizures. Correct. Okay, next question. What is osteoporosis?
Osteoporosis is a degenerative disease characterized by reduction in bone density due to low levels of calcium, leading to bone decrease, bone weakness.
A condition of decreased bone density leading to fragile bones. A condition of decreased bone density leading to fragile bones. Correct. Okay, thank you so much, the team from Agakhan. Let's have the next team on floor, and that is the team from Busitema. Busitema. In the meantime, BSU should get ready and step forward for verification. Okay. Are you ready? Okay. Busitema University, 5 questions, 60 seconds per question. Question number 1. What is a common sign of urinary tract infection? Silence, please.
For UTI, we can have painful micturition, low abdominal pain, or can have a discharge.
What's the last you said?
Discharge.
A discharge.
Abnormal discharge.
The correct answers are dysuria and then frequent urination. Correct. Question number 2. What is osteoarthritis?
Osteoarthritis is inflammation of the bones and the joints that can be caused by various causes like immune responses that can be like hypersensitivity, or we can have pathological conditions like rheumatoid arthritis.
Okay, the answer we have is a degenerative joint disease causing pain and stiffness. Wrong. Question number 3. Mention at least 2 nursing interventions for osteoarthritis.
Okay, for osteoarthritis, one, we can do pain management, which can involve warm compresses at the joints. And 2, we can encourage ambulation, which helps in maintaining the bone density. 3, we can give anti-inflammatories that help with the inflammation. And then, pardon? Diet modification to increase high calcium diet. Any other thing? We are still having our time. And then administration of prescribed medications, like painkillers. Thank you.
Okay, the correct answer is encourage exercise, administer pain medication, and use heat or cold therapy. Correct. Question number 4. What are the 3 components assessed in the Glasgow Coma scale?
Okay. The 3 components are eye opening, motor response, and verbal response.
Correct. Question number 5. What is urinary retention?
Okay, urinary retention is a condition characterized by either incomplete emptying of the bladder or inability to empty the bladder, which can be caused by either BPH or neurological conditions which affect the nerve supply to the urinary system.
The correct answer, inability to empty the bladder completely. So correct. Thank you so much, Agakhan. Oh, sorry, Busitema University. So let's have the next team on stage, and that is BSU. At the same time, Cabar U University, you should step forward for verification. Let's welcome BSU. Busitema, thank you. BSU, you're welcome. Are you ready, BSU? Okay, 5 questions, 60 seconds per question. Make sure you discuss before giving your answer. Question 1. Mention at least 2 nursing interventions for an adult with epilepsy. Silence, please.
Administering prescribed antiepileptics, then positioning the patient in recovery position to prevent aspiration, then clearing the environment to make it safe such that when the person gets seizures, you will not get injury.
Okay, the correct answer is ensure the seizure precautions, administer anticonvulsants, and monitor airway during a seizure.
Colleagues, the question is mention at least 2 nursing interventions for an adult with epilepsy. It's not saying that somebody is in attack, in seizures. So we are not going to manage this as somebody is in seizures. Yeah, so we get the point? Yeah.
So they don't get a point here. Question number 2. They said anti-epileptic.
Oh. Members, if you listened attentively to the way they framed their answer, it's like somebody is in seizures. Get it? So we are not considering that point. Thank you.
Question 2. What is otitis media?
Inflammation of the middle ear.
The correct answer is inflammation of the middle ear after or due to infections.
Members, the correct answer here is the inflammation of the ear due to an infection. Thank you.
So you don't get a point. Question 3. Team BSU, mention at least 2 nursing interventions for otitis media.
Pain management and administration of anti-inflammatory drugs.
The correct answer is monitor ear drainage, administer antibiotics, and control fever. 0. Question number 4. Let's first complete the quiz. Question number 4. What is urinary retention? As we wait for the next set of questions, the next question it will be midwifery. So the midwifery team should get ready.
Okay, thank you. Okay, thank you. We've, I think, resolved that for number 4, which was done by another university, is not done by the same university. So we've changed their question to this set which was always reserved to handle such cases. So they're going to answer number 4 of set 9. Thank you very much. I think that's my part. The rest is for the...
You're going to answer question number 5, not 4. Sorry. Thank you for that. Okay, so BSU, are you ready for your last question? Okay, so team BSU, are you ready for your next question? Okay, project the question. Mention at least 2 nursing interventions for osteoporosis.
This has been there for the last 2-3 minutes. It has been there for long.
The team says the question has overstayed. So we are going to let them do their number 5, and then we are going to set their new question. Yes, they have to do 5 questions, and we've provided the question which you say it's overstayed, and we are going to give them their question, a new one, because they deserve it.
Okay, BSU, are you ready for your number 5? Question 5, project question 5. Question 5, state one nursing intervention for urinary retention.
Catheterization.
Correct. Thank you so much, BSU. You can have a seat for a few minutes as they can rectify your issue. Let's welcome the next team from Bara University for their set of questions. Bara University. Are you ready? Bara University, are you ready? I'm waiting. So 5 questions, 60 seconds for each question, and you'll get a reminder 10 seconds to the end of your time. Let's project question 1. Question 1. Mention at least 2 nursing interventions for urinary tract infections.
Administering prescribed antibiotics, analgesics, administering prescribed antibiotics for the fever. The analgesics is for abdominal pain. Then collection of urine samples for culturing and testing. Educating the patient on hygiene and frequent urination.
Okay, the correct answer: encourage fluid intake, monitor urine characteristics, and administer antibiotics. 1 point out of 2. Question number 2. What causes epistaxis?
Epistaxis can be caused by barotrauma from sneezing, or it can be caused barotrauma to the nasal blood vessels from sneezing, from pressure sneezing, or it can be caused by blood dyscrasias like hemophilia and hypertension.
The correct answer is trauma, dry air, and hypertension. Correct. Question number 3. Mention at least 2 nursing interventions for epistaxis.
Applying pressure to the nostrils by doing a nasal pinch, and also treating the underlying cause. If it is dry air, we can humidify the air, and if it is hypertension, we can administer hypertensives, antihypertensives.
Okay, the correct answer is have the patient sit upright, pinch nose for 10 minutes, and apply cold compress. 1 out of 2. Question number 4. What is dermatitis?
Dermatitis is a condition characterized by inflammation of the skin caused by an infection or hypersensitive allergic reaction that manifests as urticaria and skin rash.
Okay, the correct answer, inflammation of the skin due to irritants or allergies. Correct. Question number 5. Question number 5. Mention at least 1 nursing intervention for dermatitis. Silence, please.
Administration of topical corticosteroids on the skin, administration of topical antimicrobials or antifungals, antibiotics, and washing away of the offending agent that is causing the dermatitis. And health.
The correct answer is avoid triggers such as irritants or allergens, apply topical corticosteroids, and monitor skin hygiene. So correct. Thank you so much, Must, for that. So right now we are going to be, the next program is going to be communicated. Okay. Okay, so we have one pending question for BSU.
the very right protocol you're going to follow.
So let's have that team from BSU do your last question, then we can switch over. BSU? Okay, BSU, are you ready for your question? Are you ready? Okay, project your question. A patient on insulin complains of tremors before lunch. What should you do as a nurse?
check for sugar levels by doing RBS and correct accordingly if it's hypoglycemia or hyperglycemia.
The correct answer is give a quick source of sugar and then reassess the blood glucose. So that's a 0. Right away, we are going to switch over. I'm going to have the representatives to come and pick the papers for the next set of questions.
Hello, members. Just a quick communication, a quick response to BSU. Question one about the interventions for epilepsy in an adult, they earn a half a point. Yes? Question 2, that was about otitis media, they get 1 full mark. Question 3, that was about the intervention for otitis media, they get a half. And that's all. Thank you. So,
Okay, so for the next program, the errors are being rectified. They are being rectified. They're all going to be communicated. Kindly write down your concern and it can be addressed.
members, we have a host of concerns that were to respond since yesterday. It's our mandate, and we shall respond to all of them. We shall respond to all questions one by one. But this one was an ectopic one because they had like some concerns for 3 questions straight. So we thought we would provide that response. Okay. But all your questions, all your concerns will be addressed.
Thank you so much, Chief Judge, for that clarification. So we are going to be switching over to midwifery. And just a heads up, midwifery is MCQs as well. So we are going to be choosing our numbers. One by one, you can come and write your number. Who has number 1? Who has number 1? Who has number 1? Right. Set 1 is IU. Who has number 2? Sorati University is number 2, so both teams should prepare to come forward for verification. Set number 1. So IU, come forward for verification. And the team from Busitema, Sorati University also come forward for verification. As these are being verified, the third group should also get ready. So we have group 1, set 1, set 2, and then set 4, which is Imbara University. You should all be ready. Okay. Set number 1. Set number 1. Are we ready? Okay. So we are going for midwifery. This is set number 1. Same rules. Are we together? You have 5 questions, 60 seconds to answer each question, and you get a reminder 10 seconds to the end of your time. Okay. Are you ready?
Yes.
Question 1. Protracted dilatation is diagnosed when the cervical dilatation Can we be silent, please?
Okay, we take C.
The correct answer is D. Question 2. Cord clamping is done.
We take D.
The correct answer is D. Question 3. Question 3, please. Connectorus is a condition in neonates caused when a neonate is. It was correct.
Okay, fine. We take C.
The correct answer is C. Question 4. Fertilization takes place in part of the fallopian tube called.
We take D.
The correct answer is D. Question number 5. The part of the ovum where the sperm passes first, first enters accessing the egg is called. Answer. Can you face that? Can you face the screen, please? Face this side, and make sure you stand in a line.
We take A.
The correct answer is A. Thank you so much, IU. Let's have the next team. That is from Sorati University. In the meantime, let's have the team from Bara University prepare. Bara University, come forward for verification. Bara University. Soroti University, are you ready? Are you ready? So you have 5 questions. 60 seconds to answer each, and you'll be reminded 10 seconds to the end of your time. Question 1. The passenger is likely to affect labor if the fetus is. B. Correct. Question number 2. When is suctioning of the newborn done after delivery? Silence, please. A. The correct answer is D. Question number 3. The embryonic period is the period from. B. Correct. Question number 4. Family planning information is important in preconception care in order to. A. Correct. Question number 5. Moral.
B.
D, eh?
B for boy.
Okay. Correct. Question number 2. The popliteal angle for a term newborn is at. Silence, please.
B. B.
Correct. Question number 3. Which of the following develops from the endoderm? The teams at the back.
C.
Correct. Question number 4. Preconception care is recommended for any woman before pregnancy within.
B.
No, the correct answer is C. Question number 5. During the process of fertilization, the zygote is formed when.
A.
Correct. Let's clap for Barrow University. Barrow University, and welcome the next team on stage, and that is Busitema. Busitema University. So Bishop Stuart University, come forward for verification. Okay. Busitema University, are you ready? 5 questions,
Yes, we are
60
ready.
seconds. Okay. Question 1. When there is a uterine inversion, it's diagnosed as prolapsed when the uterus fundus is.
The answer is C.
The correct answer is D. Question number 2. The skin appearance in preterm is? Let's face forward, please. Don't look back, please.
B for boy.
The answer is B.
The correct answer is C. Please make a line and face forward. Question 3. Which of the following leads to erythroblastosis fetalis? Silence from the crowd.
The answer is B.
Correct. Question number 4. During antenatal care screening of severe condition, is done so as to?
The answer is A.
Correct. Question number 5. After fertilization and cell division, the placenta is formed from the?
The answer is D.
Correct. Thank you so much, Busitema. Let's welcome the next team. That is Bishop Stuart University. In the meantime, Victoria University, come forward for verification. Okay, Bishop Stuart, are you ready?
Yes.
Okay, Victoria University, are you here for verification? Okay, this is number 6, so those are like 5. But I think we are going to be fast. So that is all, the rest are all just continuous. Is it? Okay. All right, Bishop Stuart, are you ready? 5 questions, 60 seconds, and you get a reminder, 10 seconds to the end of the time. Make a line, face the screen. Make a line and face the screen. Okay, can we have total silence, please? Question 1. After delivery of the baby, IM oxytocin is given when the
B.
Correct. Question number 2. The normal breathing rate of the newborn is?
D.
Correct. Question number 3. Which of the following muscles connects the ischium to the coccyx?
D.
The correct answer is C. Question number 4. After fertilization, when does cell division result in conjoined twins?
D.
Correct. Question number 5. During early pregnancy, the cardiac output increases and the stroke volume. This leads to?
A.
No, the correct answer is C. Thank you so much, BSU. You can bring your concern to the judges' table and it can be addressed. Let's have the next team on the floor. So we are going to set number 7, and that is Victoria University. In the meantime, let's have Cabar University come forward for verification. Cabar University, come forward for verification. Okay, Victoria University, are you ready? Make a line, face forward. Can we have some silence from the crowd? Okay, 5 questions, 60 seconds. Question 1. In normal presentation, the occiput is presenting part, and for delivery to easily occur, the fetus has a fully flexed attitude. Which diameters are presenting in the pelvis?
A.
Correct. Question number 2. The average weight of the newborn baby is? Let's fast forward.
C.
The correct answer is B. Question number 3. Which of the following forms the largest muscle of the pelvic floor?
A.
Correct. Question number 4. When does monozygotic twins occur? Silence, please. Don't look back, please.
B.
D, right?
B.
B. Correct. Question number 5. During the second trimester, after complete formation of the uteroplacental circulation, there is
B.
What was your answer?
B.
B. The correct answer is C. Thank you so much, the team from Victoria University. Okay, so the next team we shall be having, that is Cabar University. In the meantime, number 9, that is Moon University, come forward for verification. So at this point, the teams that are done, the team members can go and have lunch. So when they come back, we just continue. Okay, the teams that are done. So, IU, Kabare, IU, Soroti, and Must should go for lunch. Okay. Set number 8 for Cabar University. Are you ready? 5 questions, 60 seconds each question, and you'll have a reminder 10 seconds to the end of your time. Okay, question number 1. Which diameter does the fetus engage in?
B.
Correct. Question number 2. Every newborn is assessed using the APGAR scoring. And during this assessment, grimace is assessed using
D.
No, the correct answer is B. Question number 3. The female external genitalia, that is a pad of fat that is located over the pubis bone, is called? Silence, please.
B.
Correct. Question number 4. What is the normal amniotic fluid levels at term pregnancy? Silence, please.
A.
The correct answer is D. Question number 5. Which of the following causes physiological anemia in pregnancy?
A.
No, the correct answer is B. Thank you so much. This is the team from Cabar. Thank you so much, Cabar team. And let's welcome the next team on the floor. Let's welcome Muni University on the floor. Okay, in the meantime, Makerere University, come forward for verification. Kindly stand in a line and face the screen. The gentleman at the end. Okay, feel free to push this side if you want. Okay, so, Muni University, are you ready? 5 questions, 60 seconds. And you'll be reminded 10 seconds to the end of your time. Question 1. Which of the following is an indicator of an adequate pelvis?
Our answer is C.
Correct. Question number 2. The mother who is diagnosed with multiple gestations can be delivered by cesarean if silence.
Our answer is B.
The correct answer is C. Question number 3. The inner mucous membrane of the vagina is referred to as
Our answer is B.
correct. Question number 4. Which of the following pregnancy-related dermatoses begin with urticaria papules and plaques around the umbilicus?
Our answer is D.
The correct answer is B. Question number 5. High progesterone levels in pregnancy causes the following.
Our answer is D.
The correct answer is C. Thank you so much, the team from Mooney University. Let's welcome the next team on the floor, and that is Makerere University. Okay, in the meantime, Lira University should be preparing to come for verification. Lira University, step forward for verification. So, Makerere University, you're here for set number 10 of questions. Are you ready? 5 questions, 60 seconds for each question. And you'll be reminded 10 seconds to the end of the time. You can extend this side. Okay. Are you ready? Are you ready? Question 1. Braxton Hicks contractions are different from the true contractions because they A. Correct. Question number 2. During management of a cord prolapse and it's still pulsating, it's important to B. Correct. Question number 3. The oocyte in the ovary is supported under the D. Correct. Question number 4. Which of the following hormones is the highest in the first 20 weeks of pregnancy? D. The correct answer is C. You can bring your consent to the table of the judges. Question number 5. How many times is intermittent presumptive treatment given during antenatal care attendance?
C.
The correct answer is B. Thank you so much, Makerere University. Let's welcome the next team on the floor. Let's welcome the next team on the floor, and that is Lira University. In the meantime, Agakhan University, come forward for verification. Okay, are you ready? Lira University, you have 5 questions, 60 seconds to answer each, and we remind you 10 seconds to the end of your time. Okay, question number 1. While assessing the fetal heart rate, it's described as having late decelerations when the fetal heart rate decreases. Let's face forward.
Our answer is B.
Correct. Extend this side. Okay, question number 2. When managing a shoulder dystocia, it's important after diagnosis to immediately silence, please.
Our answer is C.
Correct. Question number 3. Question number 3. Question number 3. Which part of the fallopian tube does fertilization take place?
Okay, our answer is B.
Okay, you're going to get another question for that. That was repeated already. So we have No. Okay, so you're going to complete the other questions. Question number 4. During an obstetric abdominal examination, the lateral grip is done to determine the
Our answer is A.
The correct answer is C. Question number 5. Mother has come for antenatal, and this is the first time. She tested for HIV before pregnancy 2 months ago, which was negative. What is the criteria for HIV testing in this mother?
We are taking A.
Correct. Stay back for one question. Let's project the question. Okay. Okay. Lira University, one more question for you. Are you ready? Okay. Let's project the question. Okay. So you have one question to go. Are you ready? Question number 5. When the placenta is retained during 3rd stage and requires removal, which of the following is done during removal? Silence, please.
Our answer is C.
Correct. Thank you so much, Lila University. Let's clap for Lila University. Okay, let's have the group from Agakhan University. Agakhan University.
So we're going to follow. Let's
project takes forward. But we are still working on the school.
Sorry for the inconvenience, just a minute. Epidural anesthesia, when given to mothers in labor blocks. In labor, blocks nerves up to
The answer is D.
Correct. Question number 2. Question number 2. Postpartum depression is different from postpartum psychosis because? Silence, please.
Answer is D.
Correct. Question number 3. Which part of the uterus does implantation take place? Silence, please.
Answer is A.
The correct answer is B. Question number 4. A mother has come for antenatal care today. That's the 5th of May 2024. And she reports her first day of the last normal menstrual period was 8th of March 2024. What is the weeks of amenorrhea on the date of the visit? Silence, let's look forward. Participants, let's look forward.
The answer is A.
The correct answer is B. Question number 5. Mother with preeclampsia, it's classified preeclampsia with severe features when the silence, please.
The answer is D.
Correct. Thank you so much, the team from Agakhan. Let's clap for them. Okay, so that marks 11 groups for midwifery. So the next program is going to be communicated. Okay, and all your grievances are being worked on, so they're going to be communicated as well.
Thank you very much, everyone, for this session. And I want to communicate this. People that have not yet had lunch, you can go for lunch, including the panelists and the admin. Thank you. Then those who have finished their lunch, you can give us space in the canteen so that we can get the other groups eat. Thank you.
Hey, welcome.
Good evening, everyone. How are you doing? I know we are tired, right? We are not tired. You want one more round? You want the cake? Okay, I just want one hand here and one there. And tell me what's the problem. Yes? Thank you so much. Let me have somebody write down those comments. One person from this side. Yes? Yes? Please?
Or they're from Kampala. You cannot quiz someone on just 6 course units, on all the course units that have been covered. And then also, then also the issue of time is not our problem. We moved from far. Time management, you guys have failed to keep time.
Okay. All right. I've had. I am also as disappointed as you are. Yes, nurses. Listen. I am going to have a meeting with the various presidents. So we had a very good plan. Let's listen to each other just as I listen to you. We had a very good plan to have all course units covered within the 2 days, but unfortunately things come and go here and there. Organizations, yes, let's have some order. It's all right, I understand. But from the course units that we have had, I'm sure from the course units that we have had, the knowledge has been assessed. I am sure from the course units that we have had, the knowledge has been assessed, and the problems or the queries that you had, your lecturers are representing you. Your lecturers are having a meeting. They are going to represent your ideas there. And we are going to have a very wonderful, beautiful solution for everyone. Is that okay? The trophy is going to be given to the best university. Otherwise, we are very happy to have you in Mbarara. I know there is a lot of dissatisfaction here and there. I know there is a lot of dissatisfaction. But the National Executive Committee together and we are trying our best to represent you. Is that fine? So all the queries we are going to have, when the judges come back, we are going to address them. But for now, there is a lot of information we want to put out there, even without the quiz. Yes. When the judges come back, we shall resume this conversation, and we shall have a fair hearing from each and all of you. Is that okay? No. So we shall have a fair hearing from all of you when the judges come back. But for now, I want to first of all thank the different mother association presidents who have enabled each one of you to come here. It has not been easy, I know. The organization has not been easy. People came from different parts of the country, different regions. And I want to just thank the president of Lira University, wherever you are. Let us give him a hand clap, please. Yes, the president and lady vice of IU, please. Let us give her a round of applause for the good work she has done. Yes, the president of Busitema University. Busitema University. President Makerere University. Yes, thank you for the good work. I hope you can tame your team better. Which other university? Mbarara University. The president. Yes, Mr. Tony Blair, thank you so much. Victoria University. Victoria University. The guild president, Mr. Innocent. Thank you so much for the wonderful work done. Bishop Stuart University. The president, Bishop Stuart University. He has done a very tremendous work for organizing. You've eaten, drunk, and there are a lot of gifts for you guys. Lira University, okay, yes. Muni University, the president, Muni University. Muni University. Which university am I leaving out? Cabar University. President Cabar University, thank you for the tremendous work. I really appreciate, I'm much honored. We couldn't do it alone. We needed you on board. We couldn't do it without you. Which university am I leaving out? They are over. Yes, the different MSA presidents. We are really happy for the good work you're doing. And as the president of the Inter-University Nursing and Midwifery Students Association, I should say I'm very proud of where we have arrived at. I have seen this activity grow from a very small number to the number that we are today, even beyond 300 students. And I believe that bigger and better
now meeting the president before you go to make your because the decision is going.
Yes. Yes. As I said earlier on, we apologize for any inconvenience, anything that did not go well. I will carry that burden, and we shall make sure that at least INMSA Quiz 2026 is better. Is that okay? Is that okay? Yes? So we shall make sure that the next one is better than the latter. Is that okay? Yeah, so I have seen this activity grow from small numbers to what it is today. From around 3-4 universities to having 11 universities. And I am assured that probably next year we shall have even more universities joining us, probably around 18 to 19 universities, all of them participating. The Inter-University Nursing and Midwifery Students Association is an association that umbrellas all the bachelor nursing and midwifery students. And one of our core goals is to ensure that we bring out competent nurses who can handle situations even when things seem to be going wrong. Yes? We need competent nurses, nurse advocates. We need nurses who understand, who have the knowledge, who have the evidence-based practice, and we are trying to build that through the various endeavors. I don't know if my project secretary is here. Yes, you can come. But we have very many projects that we have as the Inter-University. And if you're out there and you've not been knowing, these are the projects that have been going on. Through the projects team, we have had students traveling and representing us, most of the nursing fraternity in various countries in areas of research, where we normally go for the International Nursing Research Conference. And we are having the next International Nurse Conference happening in May. That is May 10th and 11th. Yes? It's happening in Rwanda, and arrangements are underway. We are trying to get a very beautiful student package. Yes, it's the 11th and 12th of May. And we are trying to get a very beautiful student package. And if you have any beautiful innovation, I want to see nurses that are thinking out of the box. Nurses, not like the days whereby in various research NGOs, nurses are advocating at higher levels. I was impressed by Canada, where the Minister of Health is a nurse. The new Minister of Health of Canada is a nurse. So I believe there are various levels as nurses that there is so much we can achieve, and there is so much potential that we can achieve if we identify ourselves as nurses and we are passionate in what we do. Through the project secretary, I'm going to give him maybe 5 minutes to talk about the projects that we have this year that you can be part of from any university that you're in. And through your presidents, we are working closely with them. We want you guys to attend these activities at a subsidized price, not hiked prices. Yes? So we shall, those who are going to be traveling with us to Rwanda very soon, we are going to put out those flyers. We are going to bring out the information through your presidents. If you have innovations, if you have an idea of an innovation, come to us. We can help you bring that innovation to a realization. So come and we work together, and we can achieve those goals together. So just 5 minutes, you can talk about the projects in your office, and probably I can supplement on that. Thank you, Project Secretary.
All right, thank you so much. Hello, everyone. Protocol observed. Good evening, everyone. Yeah, my name is Gambi Emmanuel, and I'm a student of nursing at Mbara University of Science and Technology, and I'm serving as the project secretary in INMSA. I'm happy to be here with you, colleagues. Yeah, as our president already communicated to us, we have the core values of our association. And most of you are complaining, but we are going even to make a Google form because we want to improve, and it's through feedback. That feedback is not bad, it's very good. I'm very happy that you're giving us feedback because it's through feedback that we can improve. And I assure you that next time it's going to be very, very better than this, because even this one is better than the previous ones. So I assure you of that. As the project secretary, I'm here to tell you about INMSA and our projects that we are having of INMSA. We had a quiz, and finally we are here. We are concluding our quiz together. Though we have had a lot of issues, as you know, but it's not our making. We have done our best, and we appreciate you people because we can't make it alone without you. It is you who make us stand here. We can't make it without you. So I thank everyone who has given us that time to be together with us here. Thanks all. We're having other projects that we are cooking, and in my office, next month we're having a trip to Rwanda. It's a third annual. Sorry. It's a third annual international nursing symposium, and it's going to be in Rwanda, Kigali. So it's there next month, 11th and 12th. And we are organizing because we have to look for funds, because most of us can't manage to fund ourselves for that trip. So we are looking for funds, we are looking for fuel, so that at least even when we ask you for some money, it's not so much, because most of us can't manage facilitating ourselves. And the president is doing his best in his office. He's visiting all funders so that they can fund that trip to Rwanda, Kigali. And I'm working tooth and nail in my office to make sure that it's a success. And I'll be notifying you, those ones who are on our platform, and that's INMSA. I'll be posting our posters and flyers about this trip. And it's going to be there next month. And that's May 11th and 12th. Yeah, we are also having a campaign. We are cooking a campaign. We are not here to have the knowledge as we nurses and remain with it. We want to benefit the community. And in my office, I'm having a campaign about hypertension, diabetes, and Ebola. We had an annual outbreak in Uganda of recent, and that's Ebola outbreak. And if we can see, there's a rise in the percentages of the non-communicable diseases. It's rising, especially diabetes and hypertension. So in my office right now, I'm cooking. I want our students to have some CMEs. We are going to have CMEs and webinars to enrich us with knowledge. And after that, we are looking forward to going in the communities and online campaigns, because we want to impact the community. Our association needs visibility. And the way that we can build that visibility is through having such things. We go to the community, we teach them, we intervene in all matters in the community, especially in when you look at the non-communicable diseases, hypertension, diabetes, though Ebola is communicable, but we had a recent outbreak. So we have to teach the community, because it's through community engagements that we can manage to help the community reduce on the outbreaks, and even it boosts the publicity of our association, because you find that some students from other universities never knew about INMSA. They never knew about INMSA by the time I entered this office. But I'm working hard with you people. That's why when I post something in INMSA, I always tell that you share, because we need the funding to have such events. We need the funding. But they can only fund us if they know us. If they don't know us, we can't get funding to have such events. Even the money that you give to us when we are organizing such events, it's not enough. So we need the funders, but it's through publicity. If they know that the association is there and is active, they will fund us. So we are having that in this office. And we are also going to have a general assembly, and that will be August this very year. we are going to have a General Assembly, and it's going to be at the Busitema University. Yeah, I know the president of Busitema and this executive, they are not settled right now, because you know when you're hosting, you have to be very active. Right now, Honorable Samuel, who is Honorable Samuel, you can tell what happened here. Thank you so much, brother. He's the president of Bishop Stuart University, Nursing and Midwifery Students Association, and he has done a lot. We should all appreciate him. He has done a lot for us. So, Busitema University, you're going to host the General Assembly in August. And you people, I know you're not seated also, because hosting an event is not something small. There is always criticism, but it helps us to improve. Just like Bishop Stuart has hosted, and right now they know what it means. And I know even our hosts for the next quiz, they're also going to experience that feeling that Bishop Stuart University has experienced. But we shall improve. I promise you that. Yeah, just 1 minute. Yeah, we don't have time, and I'm finalizing. And as I finalize, I tell you all, we shouldn't be angry. We didn't come here to get conflicts. Me personally, I came here to create friends. Social capital is very key. Don't leave here when you're disunited. You come united. So make sure that by the time you leave, you know Igambe Emmanuel, I'm Igambe Emmanuel. Make sure that you know me. Make sure that by the time you leave here, you have contacts from different students. Because we need social capital. After your bachelor's degree, you can find yourself that you can start home without any connections. There are very big people around us, but we don't know them. But if you approach them, you greet them, tell them, I'm Emma from Cabar University, they will tell you where they're coming from. Some of them are lecturers, though they look like your age mates. They are big people in big offices. Social capital is very key. So by the time you leave here, make sure that at least you've created new friends. Yeah, another thing, we need motivation and mentorship. It's one of the things, one of the values. That's why we come up with such events. By the time we leave here, you should be knowing some things about your profession, midwifery and nursing. That's why yesterday people were complaining. So many speeches. But motivation and mentorship is key. And in my office, I'm working on that also. I'll be sending links for webinars, and we are organizing one right now. And it's going to be about diabetes, hypertension, and Ebola. It's more of a CME. And I believe after that, we shall engage the community, and I believe we are going to achieve together as nursing and the midwifery. Thank you so much, everyone.
Yes, a round of applause for the project secretary. I'm working with a very beautiful team of individuals. They are dedicated to what they do. They are our fellow students, nursing students. These are guys who have dedicated some extra time on top of their academic life to ensure that something like this happens. And when something like this happens, probably you go away from this place with a new friend, with a new number. I got to meet very new faces, very new people. And we interacted, and I made them my friend. And I'm sure they will be willing to help me, or I will be willing to help them wherever I can possible. So this is the National Executive Committee, and I think they are faces that you know. They are your representatives. And each day of the year, each week of the year, each Tuesday, we have a meeting. And that meeting is to ensure that your lives are made easy. And that meeting is to ensure that such activities happen. So I want us to at least applaud them. Even though things might have gone wrong, let's give them a round of applause. The project secretary has spoken. Probably that is just a pinch of the things that we want to achieve this year. And I think he talked about the GA, and I hope Busitema University is ready to host the GA for us. Are we ready, Busitema Mbale? So the GA is going to happen in Busitema, and I don't know if the president of Busitema University can say something about that, or the speaker. Is there something you want to promise these guys on the GA? Yes, thank you.
Good evening, ladies and gentlemen. My name is Onyang Nicholas from Busitema University, and I'm the speaker at the NEC. About the GA, when we asked Busitema whether they are very ready for this GA, someone told me they look very cold. But trust me, those guys are very ready. In fact, what we are cooking for you is going to be far much better than you have ever expected or ever seen of a GA. Yeah? If you really want to feel the vibe, get me right, if you really want to feel the vibe, visit Busitema University Nursing Students Association. You won't come the same. In fact, you may want to be part of them in every occasion in your life. I assure you that. Yeah, I'm sure some of you have already felt that vibe, whether within here or even in some other occasions we've shared together. Yeah, maybe something else that I may need to add to what has already been spoken. First of all, allow me to apologize on behalf of my team if there is anyone who has stepped on your toe, or if there is something that has gone below the expectations that you had of us and maybe of the whole of this occasion, because trust me, this is an army that we have been working with. They are the background of whatever here is. They are, I should say, the fuel. Just as they told you, I'm the one who always puts the house in order when we have the meetings every Wednesday, I should say. Right? It's every Wednesday from 8 to 9. We always have meetings to make sure such a thing happens. And I want to take this opportunity to congratulate all of you for being here and to thank Bishop Stuart University. I think you people must have witnessed the organization in this university. Yeah? The dedication these people have to host us here. The resources they have put to make sure that our welfare here is what we wanted and even far beyond. For us as the NEC, really, we don't have the best words to express how happy we are, and we don't know how we can repay them, but otherwise, we would actually pray that all the wishes this university has, all the mission, and all the objectives they have be achieved in Jesus' name. Yeah? Otherwise, I'm very happy. If you know me, if you've ever seen me, if you've ever met out there, and you need my number, I'm free to give it out. Yeah? We are here to make friends. I'm not going to vibe you. Yeah, I'm not going to vibe you. We are making friends. There are some people from some universities, because they know I'm from Busitema, and probably they want to win Busitema, and maybe they have failed. They don't want to talk to us. Doesn't make sense that way. Let's make friends and live here with at least 5 numbers. That would be better for your life. You will never have an opportunity to meet some of these people after here. Yeah? Otherwise, I wouldn't wish to waste a lot of time. Thank you so much, everybody.
Okay, thank you, Speaker. I just want you to mention your name, your post, and your university you're from. And yes, we can start with Honorable Eva.
Hello, everyone. I'm so appreciative to see you around here. I'm Eva Nakanjako, Year 2 Midwifery, Lira University, the representative of midwifery students within Uganda. Thank you.
Hello, everyone. I'm Luze Isma, the president IU nursing students, and also the finance secretary in INMSA.
A good evening to you all. My name is Martha Ayobazibwe, a Year 2 Busitema University, representative for nursing students on INMSA.
Good evening, ladies and gentlemen. My name is Atimango Mary. I am the Vice President, Entire University Nursing and Midwifery. I'm in Year 3 BNS. Thank you. Busitema University.
Good evening once again. I'm Igambe Emmanuel, a student of nursing science, Cabar University of Science and Technology, and I'm in my 3rd year. and I'm the project secretary in INMSA. Thank you so much.
Okay, good evening once again. Wanyang Nicholas is my name. I'm from Busitema University. I'm the president, Busitema University Nursing Students Association, Emeritus. Yeah? And I'm the speaker at INMSA. Thank you.
Thank you so much, National Executive Committee. Right about now, you're going to allow me invite 3 gentlemen. The first, they have been leaders of INMSA, and they were the founding members of this great association. And allow me welcome Mr. Aloysius. Allow me welcome Mr. Tuesday. And allow me welcome Mr. Richard Ailape to say a word or two to us.
The Vice Chancellor of this university in absentia, representatives of departments of various universities, the executive of INMSA, different mother association presidents, ladies and gentlemen in respective capacities, good evening. My name is Isaac Tuesday, the second of the week, and I am the founding president of INMSA. And right now I'm not a student, I'm a manager of Transformed Communities International, Eastern Region, Uganda. And I am always making sure that whatever we started is moving smoothly. And so when we are here, we are actually observing to see where improvements can be made. I will not really go much into details because of time factor. But I'm so much appreciative of the way how students are academically distinguished. I'm also academically distinguished. And I'm always happy to see you showcase your academic potential, skills, and abilities to negotiate and challenge problems that you face. And I'm so much appreciative of Bishop Stuart University. And when you hosted this INMSA quiz, I ensured that I travel all the way from Moroto to come and observe. This gentleman that you see here, he will mention his name, but at the time when we are sitting down spending sleepless nights with 4 universities that turned up for the drafting of the constitution that is ruling in INMSA, this young man, this gentleman, this general man, let me describe him in a special way. He traveled all the way from Bishop Stuart University, Western Uganda, and traced his way to Mukono district, where we sat in one of the big halls at Mukono University, called Uganda Christian University, and spent 3 days, 3 nights, 3 days, working on the Constitution. Please clap hands for BSU. Finally, I don't want to be the speaker of the day, but thank you so much, dear students. Keep that social network. Keep connecting. I have a job that I have because of my social network. I'm well connected, my dear friend. Even if I lost the job today, I'll get another one tomorrow. So, and I was not born with my network. I established this network while I was studying, while I was writing, while I was consulting people. I can assure you, your social network is equal to your net worth. If you have a good social network, you'll never struggle. Thank you so much, and may the Lord bless you abundantly.
Praise God. Praise God. Okay, in Bishop Stuart, they say our God reigns. And indeed, our God reigns. My name is Kamkam Marogias. I'm a graduate from Bishop Stuart University. I currently work or teach at Victoria University. My students are there. Hi. You're blessed indeed. So, Isaac has said all. IRAP is here, the second emeritus president of INMSA. For us at first, we had called it UBUNSA, Uganda Bachelors of Nursing and Midwife Student Association. But the whole process, the struggle we went through with the Constitution and the URSB, we had to change the name, and here we are. Just I want to mention one statement. We started this annual quiz in 2022 with 4 institutions. And we had a target of 17 institutions offering bachelors in Uganda for nurses and midwives. And today, we are 11 institutions. That's very amazing. Thank you so much. Students, leaders, thank you so much, participants. The target is still pending. We want next year to have all the 17 institutions. And the 4 statements I can say here. 1, social networking. 2, exploring our career. We want to see nursing profession growing higher. 3, this is the exposure you need. You need to build and know from each other. 4, this is also kind of tourism. From Moni to Bishop Stuart University, we have toured a lot of places along the way. So all those, we are amazed as the elders, and we shall always be there to support you. May God bless you.
In a world of intellectuals, there are quite a number of other factors that make one stand out. One of them is what many have talked about, that's social capital. And the next important one to me is the soft skills that one needs to attain. That will make you a unique nurse or a unique midwife. I'm Richard Ayelape. I was a student of Mune University, and at the same time, I'm an intern nurse at Lacho Hospital. Last but not least, I'm the president emeritus of INMSA, and last on the same association, I am the acting executive secretary of the association, where we have the whole secretariat. So I report to the current president. He's my boss. I report to him. A lot have been said, but in brief, I want to tell you a small thing about the structure of the association. Many have related us with so many other students or other association or entities. But the uniqueness of our association, because of its distinct objectives and the vision that drives this association, is that we work with the mother associations at the different institutions, not individual students. That's why they've been talking about the President Lira University Midwifery Society, Mone University Nursing Students Association President, and the rest. It's not individual student. We work with the mother association. And I'm so glad that when we started, we had about 4 institutions. But as we talk now, we have about 16 partnerships with the different universities. That's a great work that I have to appreciate His Excellency Sage on the effort he has made with his team. Secondly, this association have the neck, as Mr. Sage has talked about, and this association has the secretariat that oversees the association and make top decisions for the association according to the Constitution. And lastly, it has a General Assembly where most of the decisions are taken, or things to do with constitution amendment or drafting new work plan and other activities, elections and the rest, that I'm glad Busitema University is hosting. I believe it will be a wonderful one. And lastly, to my fellow nurses and midwives, leadership, though other people said it's inborn, but to me, I would say most times we learn leadership. In that respect or regard, I would say everyone needs a mentor. As an individual, I have over 10 mentors in different areas. I have my mentors in academics, I have my mentors in business, I have my mentors in relationship, I have my mentors in every areas. And I believe that should be something that everyone has to take on. You should always have someone that you look up to, that will guide you in the walk of life, because you can't do in life alone. That brings me to a point that teamwork is very key. One of the aspects that I'm very sure that I observed from here in this quiz was teamwork. How do you organize yourself as a team to achieve a specific objective? So in that regard, I'm so happy and glad for this SNEC for the great work they have done. I don't have much to appreciate the organizing committee and BSO for granting us the permission to come and spend 2 full days here, of which some of us are going to spend like 4 days or 3. But in a special way, I want to say thank you so much to the organizing committee and Bishop Stuart University for granting us permission and all the resources that you have put in place to see this quiz wonderful. I have organized 2 quizzes. The past 2, I involved myself 100%. I know what it means to organize and have a successful quiz. That's why if I'm to say, I would like to sit with the organizing committee and we take some soda or water, at least, because I know how it is. Thank you so much. I remain Richard Ayelape. Just a clip, something has gone off my mind, apology, about a minute or 2. In the Secretariat, one of our objectives is to see that the association moves on. We develop for you or bring for you ideas, or we develop for you projects that you can run. We look for you for partnerships to see that some of your activities moves on. And I'm very glad to see one of the core pillars of this association that is focusing on research, because we need evidence-based. And I'm also convinced for each one of you here to graduate with a bachelor's degree in nursing science or midwifery, you'll do a research. And in over 90% of the researches that we do at our undergraduate, we just dump them, or we put them in, I don't know whether in pots or we bury them. We have very good researches, but the knowledge is not translated anywhere. I'm so glad that we had made a significant efforts to bring in some partnership with one of the publishing companies, that one of these days you'll receive the communication, so that most of your researches that are good, you will liaise with the different presidents from the different institutions to see that your researches are published. At least you have one publication for your undergraduate. For those who will join in academia, will count a lot as you go higher in your academics. That's something I'm very proud of, that we already have a partnership. Most of our researches will be published. And we're looking forward to seeing, having many of our partners on board to implement most of our projects that we dream of. We are also working closely with other entities to see that we have them on board. At a due time when we agree on the terms and conditions, you'll always be notified. I'm so grateful for the team. And have a blessed day as we stay here.
Yes, thank you so much. Let us clap for them as they take their seats. They have done a great job. Yes, so if you're a good, no, executive, you can stay. Executive, you can stay. Yes, I'm still on podium. You'll leave when I leave. Yes, so they have done a tremendous work to see that we are where we are. And we are working for you guys. If it was not for you guys, we wouldn't be here. We wouldn't be organizing any of this. So we know you put in a lot of effort in that research work you do, then you dump it somewhere, but yet you can actually publish it and maybe win a grant somewhere. And NANSEs are involving themselves in research. A lot of research is going on, and you never know where your research idea can take you. People are traveling to places. People are employed by their research ideas. So we want you, even at the undergraduate level where you are, to be able to publish. And we are working around the clock to see how best we can have you guys publish those things and probably win yourself grants out there. Another thing I wanted to talk about is one of the issues we wanted to address as the NEC when we came into power was the PR image of our association as NANSEs. We wanted to rebrand ourselves and put ourselves out there on the global market. And as we speak now, we are trying to advocate for the International Federation of Nursing Students. And I think Uganda is one of the pioneers. But I'm sure with time, we shall see it come to realization. And that is if all of you come on board and we work together on this. Another thing is I want to appreciate the organizing committee and the chairman, Mr. Samuel. He has done a wonderful job. He has done a very wonderful job. Probably the person who can tell you how hard it is the organizing committee chairperson emeritus, Mr. Andrew. You can stand up and wave to us. Yes, he organized the previous quiz. These gentlemen are the reason as to why such activities are going on, and they're the reason as to why we're here. And if he really doesn't say something to us, then we would have really cheated him. So, Mr. Organizing Committee Chairperson, say a word or two and appreciate these wonderful people for attending this event.
Thank you, sir. One word is done. Okay. Yes, good evening, everyone, once again. And I guess everyone knows me now. But I'm Samuel Mwebembez. I'm from Bishop Stuart University. I'm in year 4, just counting a few weeks to call it a course. Maybe those are the job gigs, I'm around. You can call me at any time, whether at midnight. As long as it is a job, I'm coming. And one thing I'm sure about, I can work under pressure, with or without supervision. So anything concerning working, I can request. In the next 2 weeks, I will be very free and ready to work. But otherwise, you're highly welcome to Bishop Stuart University. And I thank God it has happened, because at first, it seemed to be a dream. I couldn't imagine, but I'm seeing dreams coming true. And I want to take my sincere appreciations to everyone. Thank you, members, for coming. I think BSU, we should give a handicap to these people, because thank you, members. I know I disturbed a lot. I would call late at midnight, early morning calls. But finally, the reason has been, I think it has been seen. My other appreciation goes to Bishop Stuart University. I don't know how I will appreciate them, how I wish I would remain here and volunteer and continue serving them, because they have done a very great work. They have supported us in every way, financially, emotionally, psychologically, mentally. They have supported. Whenever we would stop as students, they would top up as lecturers. Whenever we would stop thinking, because we would reach a moment, and I will not just stop there as students. Then lecturers take over and continue. And lastly, is the organizing committee, Bisunsa. These people, I know I have disturbed many of them. I call them on awkward hours. Sure, they have done a great work. They didn't see for us 2 days. Maybe I would request the visiting university at least we give a handicraft to the organizing committee. Because I'm sure we all ate. We ate, we drank. I think we even ate. I don't know. Okay. Yeah, it was really very nice. We have interacted. Last night was the best. I think everyone ate meat except those with allergies. For those who had allergies, we are so sorry. Take our apologies. Yes, some even went ahead and got some good connections, and we pray hard that those connections should move further. Next time you also call us because of such connections from Stuart University. Me, I will be able to attend. I think I don't have much to say. Maybe to recognize the association presidents, because I have worked with them. I have called Mr. Brian several times to advise me of how they did last year. So, I don't know what to say or what to leave, but I would request association presidents, at least, as we're waiting for the judges, at least you step forward and they just see for a peek, maybe. It's my humble request. Association presidents, it's a request. Because I know I have called every president in person. Yes. Yes. Let me hope we are safe. Members, don't worry, we are safe. I know it has been rectified. Yeah, we are safe. I'm very sure. Okay, members, we are safe. Okay. We are very safe. Okay, members. These are the different association presidents. And sure, it has been through their efforts. I'm sure. Members, the thing is safe. I'm very sure. Okay, members. Yeah, so members, if I don't appreciate these people, if I don't appreciate Stuart, I will be doing a disservice. Because I have called everyone, I have disturbed everyone, and I would also like to apologize to them. Members, I would also take this opportunity to apologize to these people officially. If I'm very sorry, I know I called you in awkward hours, but I beg you forgive me, don't take it personal. And I would like, in 1 minute, I can see some people I've started recording, waiting for what will come next. It won't happen, I'm very sure. Members, I would request that we take this opportunity. They also introduce themselves, the names and the university, right? In 1 minute.
Good evening to you all. My name is Semaganda Tony, the president of Cabar University Nursing Students Association.
Good evening to you all. My name is Chini Richard, and I'm the president, Leroy University Midwifery Society. We are very glad to be here. This is our third time participating, and we really thank INMSA for giving us this avenue. We've got connections, I'm telling you. People are here, people are connecting, and that's what we want. Yeah. So I take this opportunity to bring for you love from Lira. The students there have been following what's going on here, and they are really excited. We just want to appreciate all of you for coming. Otherwise, we will not have a colorful event if you did not come. Apoyo Matek. And it's at this moment that I want to inform us that as Leroy University, we feel we are ready to host. You come, we are ready to host for the next quiz. You come and visit the land of OD. You're going to find there a lot of OD. Yes. Then the last one, in INMSA, we are coming.
President Lira, next time you're coming, don't forget to bring for us some OD and a more. Okay. Praise the Lord. Assalamu alaikum. I am called Arion Innocent. I am the Guild President of Agakhan University. I am deeply honored, Mr. President INMSA, for your invitation for us to come and attend this event. This is our second time participating in this event. We are grateful. I bring for you greetings from the people of Agakhan University, Uganda campus. We have had a tremendous moment together. We have shared a lot. We have interacted. We have made connections. If you don't have my contact, please, let's make sure we connect so that we share ideas. You know, some of the ideas that can build our nation can come from among us. Do we agree with that? Please, let's connect. We stay in touch. We check on each other. Victoria University, Makerere University. If you have some event, don't forget your neighbor, Agakhan University. And the same way, we shall also invite you. I thank you all.
1 second, just a name and university. We are so sorry, but...
Thank you very much. Just as a Simwe, President, Cabar University. And I take this opportunity to thank my team. Thank you for representing Cabar, and thank you very much. And I want to thank the hospitality of Bishop Stuart University. I'm very much honored for your pleasure, and thank you very much. And we hope for the better from here. Of course, as they have said, social networking is the best key. We can move world. Thank you very much. I sign out.
Good evening. All protocol observed. My name is Nabunya Letitia Lona. I'm the president of Muni University Nursing Students Association.
Yes, once again, I applaud everyone. My name is called Nangoli Usama Hamdan, Busitema University Nursing Students Association President. Busitema Ra! Composure is key, eh? Yeah, I'm going to, second of all, I would like to invite you all for the Nursing Students General Assembly that will be hosted by Busitema University. I expect that everyone be there and witnesses integrity. Yeah, thank you. Eh?
Good evening, everyone. My names are quite tricky, eh? But I'm the man who led the people from the east, and they are the wise men from the east. I am called Obulejo James Christopher. The president of SUNSA, president of nurses from Sorati University. I don't know why I'm next to this president of Busitema, but I think it's because we are neighbors the other side, and we've become neighbors here as well. Thank you.
Hello? Hello? Victoria, where are you? Okay. Okay, members, I'm called Hosea Tugume. I'm the president, Victoria University, Nurses and Midwives Students Association. This is our first time to join this inter-university quiz. And on behalf of Victoria University, I really want to assure Ugandans, my fellow nursing officers in making, that Victoria University is a university of you, that we shall always be present in any activity, Victoria University will always be available. And I want to assure you, from here, University IU, Kampala, Kampala Central Universities, Kampala. Very soon, we talk of Makerere Islamic University, we are talking of Agakhan and the rest. But for the pilot study, we have agreed as presidents, possibly within next week, we shall have arrangement for community interventions, which we have already agreed, which we shall support the community. It's only nurses who can change the health situation of this country. Nurses, we are always undermined. Degree nurse dump dusting, who told you? It means that a nurse, we should advocate for policy change. Policy, nurses, we are beaten by policies. So we need to come up as a change, as a force of change for policy change. Victoria University, wow.
Thank you so much, Victoria University. Assalamu alaikum wa rahmatullahi wa barakatuh. The reason I've started with Salam, I am the president, Islamic University in Uganda, Kampala campus. And right now I have been elected the chairman, the Kampala caucus, and I'm going to lead the community work, as well as Mr. Money, because I am the finance secretary in INMSA. So money will come.
Emma Kelelo, Emma Kelelo, a winning goal, a losing Z, a losing Z. Ra, hello. Good evening, everyone. My name is Brian Tumwebazi, a year 3 nursing student, Makerere University. The president, Makerere University Nursing Students Association. To begin with, I will first appreciate the work done by the organizing committee of this quiz. You people who have not been in that shoe, I can testify it is a very heavy shoe. Let us give the organizing committee a hand clap. I know there are some things we couldn't have agreed as people, but those are always expected. They give us way forward of the next event so that we check ourselves and see how best we can improve. We shall also accept the challenges first, but I ask, let us receive everything that is coming. It will teach us lessons for the next coming events. The next thing, I will thank all these presidents who are here. There are very many universities out there offering bachelors of nursing science, but they couldn't make it. But these people invested in their efforts to lead their groups and bring them this far. Thank you so much. And lastly, my call would be, as we come to the very anxious time of the event, I know we are all anxious, but my request would be, let us receive everything we receive and plan for the next quiz that is to come. Thank you so much. Have a nice evening.
Thank you, thank you. I guess we can now take our seats. Yeah, thank you, presidents. And again, I apologize for calling you in awkward hours. But now I think we have evidenced why I was calling you. Yeah, this thing has been a season of learning. We have learned a lot, we have gained a lot, but finally the goal has been achieved. And I think I have nothing much to say. Maybe I call Mr. President to conclude for us. Thank you.
Yes, thank you so much, the team of presidents. We have really disturbed you people in the midnights, beyond even your working or studying hours. but it was for the good reason. I thank you so much, our lecturers who are able to join us on this wonderful occasion, the people who are responsible for our quiz setting, and on all the guests that managed to attend this event. I was talking about the PR of the association, and it is one of the things that we managed to boost the PR image of the association. And we are pleased to say that through the different endeavors, we were noticed, and we got a chance from the Diaspora Uganda Nurses and Midwifery Society, where at least a nursing student was selected to represent nursing and midwifery students in Uganda at the International Congress of Nurses that is happening in Finland. So those are some of the achievements that we have, and I think when we continue at this rate or at this speed, I can't even imagine what we can achieve, and that is if we work together, me and you. There is a newsletter call out for articles that is going on. We want to do a newsletter. If you have beautiful pictures you took of yourself during the event, and you have a beautiful article you wrote about, or you want to write about, or something about nursing, or something about policy changing, so please write down, and that article will be on our different platforms, on our Twitter platforms. We have TikTok platforms, we have YouTube, we have a website, so you can send those articles and we can publish them in our newsletters. I have greetings from the Commissioner Nursing and Midwifery, from the Ministry of Health, Madam Agnes Chandia Baku. She sent her regards, even though she didn't manage to attend this event. Our patroness as well, she sent her apologies for not attending. That is Dr. Rita Mate, and she's with us. She has been following the event, and probably she will send in her regards much later on. We want to give, we want to extend our appreciation towards AGNMU, Association of Graduate Nurses and Midwifery Union, Midwives Union, and that is an association that umbrellas all graduate nurses. This is a training ground. When you graduate, you will be able to join AGNMU in the various places you will be working in, and that is why they are working with us, and that is why we are with them today. We want to thank different sponsors, Seed Global Health, Ministry of Health, the different universities where you come from. We couldn't do this without you. With that much said and done, my name is Kagoda Sage Enoch Wanume. Yes, I was reminded of a sponsor. Yes, Sam's Food Industries. They gave us wonderful snacks. And I saw people snacking. I don't know if you got those snacks. Yes, so people were snacking. People were snacking. And we believe that with better arrangements, more activities, we have so much. We have very many people who would want to come and be part of us. The media houses, New Vision, Bishop Stuart Media, University Media, and all other media houses that were with us today. I want to extend my warm appreciation to you all. My name remains Kagoda Sage Enoch, President Inter-University Nursing and Midwifery Students Association 2025. I'm from the Islamic University in Uganda. And as you realize, on my committee, I have members from IU, LIRA, Busitema, I have from MUST, I have from BSU, I have from Agakhan, and is it Muni? And Muni. So what does that mean? It means that other universities have to as well come up on board and take up positions on the National Executive Committee. I had LIRA declaring intent to host the next quiz, but there is a procedure you go through to host the next quiz. You write formally, and all universities, if there's any other university that would want to host, Busitema is holding GA 2025. And during the GA, that is when we do our elections. So during the GA, those who will attend, you will have the opportunity to choose the next president, the next leaders. That means if you want a leader to come from your university, you have to attend the GA. Is that okay? And communications will be put out through very fast, through our project secretary and PRO. Those communications will be with you on how to apply for these different positions, what is required, what is the minimum requirement, and what is the maximum. So all those things will be sent to you guys on those media platforms. Those who want to host the GA as well can send in their request much earlier. For the quiz as well, any university, we are not saying, Lyra, you're the one hosting. Please write formally, and we can have a consideration as the executive committee. Unless otherwise, thank you so much. I'm really happy that you guys came. Thank you. Yes, associations that have not yet registered, we are working with the different associations, but to contest for a position on the NEC, your university has to be registered. But those are all details they will send to you during the time of elections. Unless otherwise, thank you so much. The NEC can take their seat. Chairperson, Organizing Committee.
Yeah, thank you so much. Let's return to this desk here for the judges to communicate.
Okay. Hello. The hour is almost where important announcements are being made in this part of the country. However, we are about to go to that hour. I may not climb up in the podium because it's not yet time. We are from a discussion and tallying of your marks. We've almost come to the end. However, we have some things that may not make us to proceed. We are 11 universities here. We are 11 universities gathered here who have participated in this quiz. From number 1 up to number 11, there are people who have tied there somewhere between 1 and 11. So, for fairness sake, we want to bring back some 3 to the stage here and then answer some questions such that we can now qualify who is placed where. Are we okay? Yes. So, sorry? The procedure. So now, these are the people who have somewhere there in the middle. And while we are doing this, there is, I think, a gift for the first, second, third, fourth, and fifth up to number 11. So we want actually to see who is placed where. So these are the members. So when I announce your group, you get ready. The quiz master is going to give you the procedure, and he's going to give you the whole protocol. So my work here is just to announce those people who are somewhere there in the middle so that we align them. So we have Lyra University, get ready, Makerere University, and Sorati University. So that said, I hand over the microphone to the chief quiz master to take us through the next stage. However, just I request for calmness in our hearts and in the house, because there are so many things that we have to mention. So I want this process to first take place, and then we come to give you a full account of all your petitions that you have put forward. Okay? Thank you.
Okay, thank you so much, Chief Judge. So this is going to be a very interesting session. So we are going for a knockout rally. Let me just call it like that. So we are going to have 3 teams on floor at the same time. We fire you, fire you, fire you until someone is knocked out. So, Lira University, Sorati University, and Makerere University. We've selected biochemistry. So pick your cream for biochemistry, and we come have some fun. 5. Can I first get a representative to come and pick the numbers? We have Sorati University already in the house. Lira and Makerere. Okay. So same procedure. We are going to have a marathon of questions. The number you pick here will determine who is going to start. I have 1 to 3, right? So question 1 will go to number 1, number 2, number 3, then we can continue with the cycle. Is that okay? Are you ready? Can I have my questions projected? No. Question 1. Cabar U. 1, Lira University, and then. Okay. So 1 is Lira, 2 is Makerere, and Sorati. Where are we going to position them? Lira, Makerere, and Sorati. Where are we going to position them? They are different questions. It's the good thing they are different questions. Yes. So on the 5, 15 people here. Yes. Who's knocked out, they go back. 15 people stay. Or the first step down. 1 person. Makerere and Sorati. Can we have your teams? Yes. Okay, let's have all the teams come forward. Pick your cream for biochemistry. Once you fail a question, you're knocked out. Number 1, Lira University. Strictly no turning. You have to face the screen. Are we together? Lira University. Okay, are you ready? Are you ready? They say you can fatten the bull on the market day. So let's fatten it today. Bring back all the biochemistry, combine it with the clinical, and then we can see who is the winner. Lira University, are you ready? Same rules. You have 1 minute, and those are 60 seconds to answer every question. We remind you 10 seconds to the end of your time. This is the point when we start praying. Eh? Okay. The next team, get ready. No turning back. Make sure you're only facing the screen. Now, if we're studying physiology, adrenaline, stress hormones are usually released in the fight-flight response. But don't worry, this is not going to be one of those. Try to relax, enjoy, take your time, discuss amongst you, and make sure you choose the best answer. And let the best win, the best team win. Okay? Do we have anyone with a blood pressure machine? We want to confirm if it is increasing or decreasing. They're trying to connect to the screen. So the DJ, you can take us through this moment as we wait for the projection. All people's content might evaporate.
DJ, are you projecting also?
how do you increase heat?
Teams, we have three teams: Lira University, Makerere University, and Sorati University. Are you ready? Okay. We have our first team, and that is Lira University. We said we have a marathon of questions. Every team is going to be asked one question at a go. When you miss a question, you'll be knocked out. Are we together? If they all miss in a specific round, they continue. If they all get, they continue until someone is knocked out. Are we together? The team, where is Team Lira? Team Lira. Is it too cold? Team Lira, I would expect someone to be very hyped by now. Okay. So we are going for our first round. Like we said, same rules. We have many questions, but you will have 60 seconds to answer every question. We shall remind you 10 seconds to the end of your time. Okay, Team Lira, are you ready? In this session, if you look back, you'll be disqualified. Make sure only focus on the screen. Any answer from the crowd disqualifies your team. So we expect total silence as they're trying to answer this question because this is a golden question. Okay. Biochemistry, we have Lira University. They are taking on their first question for the first round. Okay, are you ready? Are you ready? Okay, question number 1. A competitive inhibitor silence, please.
Our answer is C.
Correct. Let's clap for Lira University. Okay, they're still in the race. Let's have the next, Makerere University. Welcome, Makerere University on the floor. Okay, Makerere University, 1 question, 30 seconds. This determines the fate of this competition. Okay, are you ready? 60 seconds. Are we ready? Coenzyme for transamination.
C.
Correct. Makerere is still in the race. Okay, let's clap for Makerere University. Sorati University on the floor. Sorati University, are you ready? Are you ready? Next question. Which of the following is a ketone body?
C.
Correct. Let's clap for Sorati University. Lira University on the floor. Next round. The multi-million question. Okay. Are you ready? Are you ready? Project the next question. Which lipoprotein carries dietary triglycerides? Silence.
Our answer is C.
Correct. Lira University is still in the race. Let's have Makerere University. Makerere University. I told you we are all champions here. So let's look at Makerere University. Are you ready? Are you ready? Project the next question. Medium chain acetyl-CoA dehydrogenase deficiency leads to? Silence, please. Silence, please. Silence, please.
B.
Correct. Makerere is still in the race. Let's clap for Makerere University. And welcome Sorati University on the floor. Please, if we hear any sound, we're going to lead to disqualification of your team. Okay, second round, Sorati University. Are you ready? Are you ready? Project the next question. Just a second. Okay, so Sorati University, are you ready? Are you ready? Okay. Okay. Sorati University, are you ready? Okay. Project the question for Sorati University. KM is? Silence, please. Silence, please.
C.
Correct. Sorati University is still in the race. Kindly keep quiet when your team is on the floor, or even any team is on the floor, because it's going to lead to your disqualification of the team. Okay. Okay. The next round. If we hear any sound from the crowd, we are disqualifying the team. Lira University, get on the floor. Are you ready? Stand in a line and face forward. Okay, are you ready? Let's project the question for Lira University. Biotin is a coenzyme for?
Our answer is B.
Correct. Lira is still in the race. Let's welcome Makerere University. Makerere University. Yes, it's getting tight and very interesting. Huh? The pressure has now decreased. Okay, Makerere University. Are you ready? Are you ready? Question for Makerere University. Ketone bodies are produced in?
B.
Correct. Mackay is still in the race. Let's welcome Sorati University. Okay. Sorati University, are you ready? Okay. Are you ready, Sorati University? Project a question for Sorati University. HDL is involved in B. Correct. Sorati University is still in the race. It is very tight. Very, very tight. I can see people picked their cream. Okay. Okay, the team members can take a break. Relax. Eh? Take a break. We are bringing more. Eh? DJ, calm down our participants. Okay, so we are going to switch to pharmacology. So feel free to switch your team. Feel free to switch your team. Pick your cream for pharmacology. Okay. Pick your team for pharmacology. I told you we are all champions.
Yes, Ate. We can look together too. And then we these are those that we have not. And I think that's
Yes?
No, it's okay. She's assisting me. Hey, you want her that side? Oh no, she's assisting me in questions.
For me, it doesn't matter.
Just select questions randomly.
The questions randomly.
Let him just select questions randomly.
Yes?
Randomly and point.
Yeah.
Do you think I'm going to tell my truth?
Because we are taking a lot of time.
It's okay.
Yeah, it's okay. You please start. We'll talk this question as we are going to talk about it.
Let's not be on pressure. We are dealing with.
And this guy is telling me about time.
Huh? That's when we're going to have issues.
How many you have so far? 2. Which set did we do for pharmacology?
These are hard questions. Where will never wait bread? We'll never wait bread. Never wait. Never wait Nigeria, Canada,
We were thinking if the two universities are lying, why don't we give them the same method, to avoid
This is national.
Something small.
Something
I'm
small.
finishing.
They also like it, by the way. Those kids like it. They like it. They
Joshua
feel
is the right.
that they are Z. Students live music, and from here they are going to be live.
D. No, the correct answer is C. Okay. Team Sorati on the floor. Team Sorati on the floor. Are you ready? Sorati. Can we have total silence, please? Stand in a line, face the screen. Are you ready? Are we ready? Next question. If two drugs with the same effect taken together produce an effect that is equal in magnitude to the sum of the effects of the drugs given individually, it's called as indicate the drug which has greater potency of the local anesthetic action. Silence, please.
C.
No, the correct answer is B. Okay, we have our first person. So we have two remaining in the tie. So that is Soroti and Makerere to get one person. No, we only have one. Both of them have failed. Both have failed. Only one has passed. Actually, you have one of the two. Actually, we need to, yeah, it's Makerere and Lyra on the floor. Okay, Makerere and Lyra on the floor. Okay. My paper.
That means the record pass.
Okay. One representative to pick a number. Okay, are you ready? Number 1 is Lyra University. Number 2 is Makerere University. Lyra University, are you ready? Yeah. Makere, you can extend a bit. Okay. Lira University, are you ready for your next question?
Yes.
Are we ready? Let's get total silence from the crowd. Project the next question. Which of the following local anesthetics is preferable in patients with pseudocholinesterase deficiency? Time. Silence, please.
We are taking A.
No, our answer is B. Okay. This is the deciding moment. Makere, are you ready? Let's switch positions. Makere, are you ready? Are you ready? Are you ready? Okay. Project the next question. Indicate the local Indicate the local anesthetic, which is a toluidine derivative. Silence, please. B. No, the answer is C. I told you we are all champions here. We are all champions here. We are all champions here.
We can do, if one fails, the other answers it.
No, we are not going to display the answer. We are just going to let them answer first, and then we show the answer.
Very tight. Are we ready? Where should you face? Okay. So, we are projecting the next question. Project the slide. Which of the following local anesthetics is a thiophene derivative? Silence, please. Can I have my answers? So the answer for Makerere University is D. And the answer for Lira University is B. And the correct answer is C. Just refresh, but be here. We are projecting another one. Oh my God.
You can't give them position, they will just fight. You see what you've created in them, that kind of competition. They like it. Trouble. Both of them now are both. No one.
Okay. What's happening? Okay, are you ready? Are you ready? Stand in a line, face forward. Let's have total silence, please. Each team, I believe it has its own paper. Okay. Are you ready? Next question. Correct statements concerning bupivacaine include all the following except silence, please. Can we have our papers? The answer for Lira University is A. The answer for Makerere University is D. And our correct answer is A. Yeah!
God is good. God is good. And all the time. Wow. But you people, excuse me. I can see you people, you started a celebration, eh? But we haven't announced anyone to be the winner. Okay. Now, I am here to do two things. First, as I want to be as brief as possible. I want to be as brief as a skirt, if possible. One, I'm going to take you through the petitions that were forwarded to my table, and I'll be quite brief in responding to them. Some petitions were brought and we could not trace who has submitted them, but I believe if I mention the concern, you'll be able to remember that it's our university that submitted this. Some universities actually were able to verify, and we've indicated the name against. Now, there was a question on peptic ulcer disease, on definition. Someone had petitioned, and what I'm reading now is these are unanimous decisions from the panel of the 5 judges. And once they have, all of them agree to this, unless maybe someone or some of them later on make the minority report. But so far, we all are going with this. So on the definition of ulcer disease, the petition was overturned and said it was wrong because the people who were defining it missed very key words. They missed HCl and they missed Helicobacter pylori. That qualifies it to be a definition for peptic ulcer disease. There was a question on CKD definition, and the point of contestation was the time. All the 5 judges agree that the definition, be it acute or chronic, is defined or differentiated by time. So the definition lacked the component of time. About Methasia gravis, to define it, the judges all agreed that the definition was not complete. The complete definition is muscle weakness increasing with the level of activity. So, but they had only defined as muscle weakness plus something else, but they missed with the increasing activity. So that one was disallowed. About the B thiamine vitamin, initially the point was not awarded, but after thorough consultation and discussion, the point was added to their marks. About the 16 weeks of fetal development of the morula, it was correct. Initially, it was disallowed, but after discussion, it was found out to be the most correct answer. On the lateral grip for the lie, it was wrong. All the 5 judges agreed it was wrong. The correct one was position. Yeah. So about someone who is on insulin and is experiencing tremors, the judges all agreed that the correct intervention, immediate intervention, would be to give someone glucose. Because this is somebody who is on insulin and is now experiencing tremors. You would not start looking for a glucometer if you sorry about that. About the average weight, I hope that the insulin people have captured it, and you agree with the decision taken by the judges. About the average weight of a newborn, the petitioners had mentioned that it's 3.5 kilograms, but the judges all disagree with the petitioner and say the average weight should have been, it's between 2.5 to 3.5 as the normal birth weight for the newborns here in Uganda. So if you take that average, it will be 3.2, and that option was available. Osteoarthritis definition, it was wrong, and the judges still maintain it because it lacked a key word, which is degenerative what? It's a degenerative condition. So without that word, they could not allow it. Health education about hygiene, it was also wrong. The question wasn't specific. I mean, the petitioner didn't make a specific answer. There was also a question about hypersensitivity and idiosyncrasy. The judges maintain that the correct answer is hypersensitivity, not idiosyncrasy. We'll go deep into the explanations of this, but because of time, we can't do that. It will take us the whole night. But just want to give you the highlights. There was a question about the stroke volume. I think this was by Victoria University. Stroke volume. The judges maintain that it's wrong because they missed the word as increased stroke volume. The participants mentioned stroke volume. On glucose facilitated transport or diffusion, the judges awarded them a mark and said it's correct. Remember the question on glucose, fructose, galactose, that which of those was for facilitated diffusion, something of the sort. Yeah. There was a question about hearing, about the vibrations. The judges maintained that that was the wrong option. The correct option was the sound waves, which cause the vibrations, not vice versa. The mucus, about the mucus and the bicarbonates protecting the gut from the gastric acid, the judges maintained that that was it was a wrong option that they gave. So the correct one is the bicarbonates are the ones that neutralize the HCl. Yeah, not the mucus, which protect the GIT. About the cerebellum being responsible for balance and posture, a mark was awarded. They say it is a correct one because it's the one responsible for voluntary movements. About induced vasodilation from Makerere University, it is still wrong. It is not specific, the answer that they gave. About inactivation of sodium ions causing repolarization, actually, the petitioner of this question forwarded a wrong question. For him was asking about sodium, and then the question was about potassium. Yeah. So on the agonist definition, it was correct, and the marks awarded. Somebody who petitioned on that. About the hematocrit level, the correct answer is that the candidates were required to give a range, not just a single point. For example, if you are asked to give, say, what is, can I say, the normal HB, you would not say 7 or 8, but you would give the normal HB lies between this point to this point, okay? But then it was just given as a single digit. Otitis media, this was, I think, by Sorati University. Yes, it was BSU. Yeah, so it was BSU. It was disallowed because they missed the key word of infection. On the scene for a patient, on management of scene of a patient who is experiencing seizures, the judges all agreed the first action that would be taken would be to ensure safety of the scene. We all recall, or we all know, if a patient is experiencing seizures and say has collapsed on fire, you would not go and look for the airway first. You would first secure the scene and make the patient away from the scene. Okay? So a patient with stroke who is unable to swallow, you would first assess the patient before you do anything else. So the option that they gave was a wrong one. Members, I'm still continuing, but about to end. On preconception care, all the judges maintained that it was a wrong option that they gave. The correct one is 6 months. BSU, there was a question on midwifery, I think, that was talking about the muscles that connect the ischium to the coccyx. The judges, initially it was given as a wrong option, but the judges mentioned that they get the point. It's correct. So about the structure forming the middle ear, the middle wall of forming the medial wall of the middle ear. The answer they gave was the wrong one. In the middle ear, we have three structures. We have the oval window, round window, and the promontory. But if you look closely, the most prominent one that you would actually mention is the promontory. So no point was awarded. On aortic regurgitation, whether I think when aortic regurgitation increases, we would expect the pulse pressure to be affected, not the blood pressure. So it was wrong. On Apgar score, if you are assessing a child, you would assess the child using the body movements, not that when the child is crying too much, that's when you assess. No, so that was the wrong option. So these are all the petitions that people put forward. Second last, physiological anemia caused by increased iron demand. It was also wrong. The correct answer is the increased plasma. Exercise-induced vasodilation. That one also was wrong. And I think this was by Makerere University. You remember when we had that, can I say loud disagreement? Yes, so we promised that we would retrieve the recording and listen attentively to the recording. So if I think some of you can all access the recording on YouTube. It's on 3:48 minutes on the third hour and 48 minutes. So what we listened, what we found out was that their earlier answer was different from the one they asked them. So this is evidence-based. You can actually retrieve the recording and watch for yourselves. So this brings me to the end of the petitions submitted to my desk. At this point, no further petitions to be received on my desk. I believe my team has done their work. So now, let's move forward. Before we actually start the celebration, there's a beautiful cake just besides me here, and this cake, we all need to eat it. Yes. So let me call upon the organizers of the cake to come and serve us the cake. The DJ can take the center lead to organize members to come in here for the cake. So let me give the microphone to the chairperson, organizing committee, and then afterwards we shall read out the winners. So the winners must win, right? Yes, thank you. So at this moment, all of us are winners, and all of us are losers. Yes. No one is a loser right now, and no one is a winner. And all of us are winners, and all of us are losers. Okay. So let's...
Yeah, thank you. Samuel, can you come forward? May I invite our head of department with the team you seated with, together with the chief judge. Chief judge, kindly step behind so that we can have this cake sliced. Kindly. DJ. There is Emeritus INMSA, you can also join. And your colleague, I'm not seeing the chairperson. Chairperson INMSA. Chairperson. Yeah. Come on. Bring the cake down. Somewhere. It will won't fall. Let's have the cake cut, led by Sister Eve. You can have that knife closer here, and our guest of honor close. Yes. I'm going to count from 10, 7, 3, 1, 0. Hey, look where can I see? Meanwhile, there's someone who was charging a phone on someone whose extension cable here. I have the phone here. I don't know the person. Can come for your phone.
Namanya
alina mwembadi sagala kumulaba na somebody sagala bene somebody alina mwemmodi era kati newe mulaba njagala mbala sina jizudde bwechama aba balala ne bwe balekana fazali njisibira ku chemanga sipidi bwe bachenda abalala tinkwenda ateta ineshonga abalala tinkwenda
It was just here on the trees, and now it's nowhere to be seen. We can request, if I told you know where it is, or if I told you could have come across it.
Kuvugane kuleka pulasi amukiringi kamukufulati siva kumbalasi ya mulasi oyinza kutateguka
Misuwa Jonates Take a good pie, take a good sweet medication. Me and be a shida gun. Ondazo mukwano mungi wakukuko kusinga bangi nsomose emiga mingi banoonya masine first aid. Hakuna dawa, baby you're the only one dawa. Hakuna dawa, otali moyo gunuma. Hakuna dawa, baby you're the only one dawa. Hakuna dawa, otali moyo gunuma. Ati bote, chikole bote, tabula dagala mupiso bote. Tunola mo fometa mo madokta, kamata fomite daga. Episo yikwata bulungi doctor, shake before using it, shake before using it dagala. Yeah. Ondazo kwano.
Oh my God,
yeah. Baby you and I, we go there like suit and tie. Gasukali kuchai, my love is true or lie. Omutima guku watutu, yala kuvuge mu room room. Esa bonfu e yange pia brand new. Seto tan kumutongu onye fufu. Your body too cool, oh baby let's cool it. Like charger musoke, I got money in my pocket. My God, yala kuvuge ken my God, my God.
True religion. You dealing with the body, of course. Or you dealing with the boss. If we break up, yeah, you know that it's a loss. Upgraded every to the avatars. Study want me back, you can't touch this. Baby, I already leveled up. Take it to the max. Don't have to fear, number one in command. I came just to kill me in 2 militant. They won't see that it's, but I don't need a man. They love how me wine, I'm a true religion. You dealing with the body, of course. Or you dealing with the boss. If we break up, yeah, you know that it's a loss. Upgraded every to the avatars. Study want me back, you can't touch this. Baby, I already leveled up. You looking for love, and I'm looking for your love. Upgraded every to the avatars. Number one in command. I came just to kill me in 2 militant. They won't figure it, but I don't need a man. They love how me wine, I'm a true religion. You dealing with the body, of course. Or you dealing with the boss. Please just wine, let me show you to the back. Me body hotter than lava. Leave yourself up on the corner. See the thing, you put me on the water. Shake it to the max. Shake the wala. You want to put it on the shake the wala. Shake the wala to the max. Already know me body is a miracle.
Okay, let's have our head of department who is going to invite our guest of honor to close officially the function, but also usher in the declaration of results. Sister Eva, shall you come forward? Let's listen briefly. We are going to have a very brief closure as we wait for the judges to finalize and unpack their results.
Study want me back, you can't touch this. Baby, I already leveled up. You looking for love, and I'm looking for your love. Baby, you can handle all the sauce. And if you hear this song, then go on, let your back. Go on, bend your knees, baby, shake it to the max. The DJ, please turn up the bass to the max. Please just rewind, let me shake it to the max. 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 Please just rewind, let me shake it to the max. Don't have to fear, number one in command. I came just to kill me in 2 militant. They won't figure it, but I don't need a man. They love how me wine, I'm a true religion. You dealing with the body, of course. Or you dealing with the boss. If we break up, yeah, you know that it's a loss. Upgraded every to the avatars. And if you hear this, then go on, let your back. Go on, let your knees, baby, shake it to the max. Gypsy walk on Bunganda.
Dola zokaze zinkuwa Mundra Nyanya Mbana Nyanya Mbana Nyanya Mbana Sente malaya Ajirina ya tugamba Sente malaya Katojirina tutugamba Kasiya No, don't say that
Let's listen to one another. Protocol observed. Good evening, everyone. I want to congratulate the winners of this quiz. And for the people who did not win, just take heart. You know, yesterday I said this is not about winning or losing, but it is a learning experience. So the result is going to be the next time. Without wasting time, because I know people are already tired, I'm going to invite our guest of honor who is going to give the closing remarks, Madame Naburo Harriet. Madame Naburo Harriet is a midwife specialist, and she's currently doing her PhD, and she's the head of department at Mbarara University. Yes. Madame Harriet, you're welcome.
Thank you very much. I'm honored to be here. I greet you all in the name of our Lord Jesus Christ, who has reigned on this activity for these 2 days. I'm going to request you to stand up and we observe a moment of silence. On Monday, we lost a student at Barra University of Science and Technology, Miss Atweta Lydian, who passed on due to pulmonary embolism, and she was doing a Master of Nursing in Pediatric Clinical Nursing. Please observe a moment of silence for her. Okay. Eternal rest grant unto her. May perpetual light shine upon her, and may she rest in peace. Okay. Okay. So I'm humbled to be invited here to the 4th Inter-University Nursing and Midwifery Quiz. So looking around, I know very many people in here, and I'll just say, let me observe protocol. The lecturers, my former classmates, and the students' body. Let me just observe protocol. I will first make my classmate and my discussion mate, I will give her special recognition, Lydia Asasira, and yes, she was my classmate at Barra University of Science and Technology, and I used to call her my social support person, and she still is. Thank you, Lydia, for coming. And also among the judges, I can see my own student, Peace. I am glad to see Peace again. I hope, Peace, you are still disciplined where you are. She was a very bright student of mine. I can see Okot, yes? Odi? Okiria, yes, Julius. You did both your undergrad. Yes. That was my student for both undergraduate and masters in critical care at Cabar University. I can see Gladys. Gladys was my student. I can see Clement. That one was also our student in Cabar University. I'm not so old, please. And very many. I was also very happy to see the students from Makerere University because that's where I did my master's in midwifery and women's health. And what I remember about Makerere, it's undoubtedly the best university in the country. But we were staying in Dag, and they had this slogan, they either lose or we win. So for us, in the postgraduate students, when we would hear that, we would just take off to Dag. That was our hostel, because the next would be stones and what? Because the saying would be, they either lose or we win. So you knew that they are not happy with something. But undoubtedly, I enjoyed my 2 years in Makerere, and you are very welcome to Bishop Stuart University. So today, the theme was empowering nursing and midwifery students for excellent professional practice. And since we are all in universities, universities have 3 functions. One is teaching, another one is community service, and another one is research. So to be specific, nursing, research. And for us, we are saying, though we have all the 3 functions, with the 3 competencies, the knowledge, the attitudes, and practice, but we are being called to translate the knowledge we've studied in class to practice. And then also, there has always been very bad public opinion about nurses. So we are saying, as nurses of the new generation, we are going to have good attitudes to improve the public image. But above all, the best nurse is the one who is good in practice. So I like the theme so much. Practice, it is. It will not help us for you to get a 90 in class, but you cannot put an NG tube. You get me? So you have to balance the knowledge and practice. And I noticed that the bachelor-prepared nurses are tending to take the route of research and community practice, and they are shying away from the clinical practice. And I would like to call us, to call all of us to get more interested into the clinical practice. Really, I think because we've done more of the reading, when we finish, they expect us to be handling the dialysis unit, they expect us to be handling NICUs, but I noticed that most of our nurses at the bachelor level want to go to research, to teaching, and even teaching, they want to do theory teaching. So please, let's embrace the clinical practice. I had someone saying that bachelor prepared nurse dump dusting And I was like, so when you dump dust, does it take away your degree? Because, and that has caused us to give away our roles. For example, I'm giving an example of like in labor ward. I will give more examples skewed to midwifery, naturally. So for us, when we were training, we would handle the delivery beds ourselves. But now I notice the current nurse wants to conduct the delivery. They will not even clean the instruments. They are now using the instruments as disposable. So you will find that you have to go to look for the delivery kit in the sluice room because someone did not want to clean them. So for me, what I do, if you want a case, before I sign for you, you present to me a clean bed, you present me a clean apron, you present me clean gumboots, and then you talk about the delivery and how you conducted it, then you will get my signature. Okay? So those things of saying, dump dusting, we are past that. I mean, you are the one who has learned IPC, infection prevention. You are the ones who know about waste segregation. And these cleaners, when they come, they just start working. They are not even inducted. Some of them don't even know how to wear gloves. Some of them should be wearing heavy-duty gloves, but they are putting on the cleaning gloves. So it is us to induct them into infection prevention, to teach them how to wear those protective gear, but we are shying away from that. It doesn't take away our degree. And then also the challenge I notice with our trainings at bachelor's level is the central timetabling. Like for us at Cabar University, we are under the Faculty of Medicine. So you notice that our timetable has to be made by, we have to follow the faculty timetable. And I think maybe on some other universities. But I like that Bishop Stuart, for them, they are able to make their independent timetable. So they are more on the ward than us, who are having to go and share course units with the rest of the students in the Faculty of Medicine. So central timetabling is affecting us by reducing our clinical time. So nurses from Cabar University, mwebereremu, okay? Mwebereremu, and you know what we usually say, we have to create time for clinical experience. And then also what I notice about the bachelor prepared training is that most of our training sites are not ideal. So the lecturers, I don't know how you are handling. I don't know whether you have to teach students how to improvise. And then if they are working in places like Nakasero, Kororo Hospital, where they will find everything they need and how they behave when they are working there. For example, yesterday, but one, I was teaching students about bladder training, and I talked about a spigot, and they were like, "Madam, what is a spigot?" You know? And these are bachelor prepared, and they are in third year, and they are asking, "Madam, what is a spigot?" And some of them have not seen an amplifier, for example. So, and they are in Bara Regional, they are using the thing of the glove to tie the cord, but they will work in Kororo where there is a cord tie, a cord clamp. So lecturers, how are you handling students who must practice in ideal settings when they have trained in settings that are not ideal? Even our skills labs. You look at the government and the private. We are having a challenge. I'm about to finish. We are having a challenge that enrolled nurses and diploma nurses are better trained than us. So we are going to have to style up, okay? Why am I saying that? They have better equipped skills labs and their hospital practicum sites are better equipped than ours. So each one of us is going to see how they fit in, Like when you're taking your students to nursing education, I don't know what has been the experience of everyone, but for me, what I'm doing, because our students will be going to schools like Kagando, schools like Ibanda, Nyachibale, where the skills lab is equipped with things they have not seen in Barara. So I make sure that they do the micro-teaching theory as well as the micro-teaching in practical. Why practical? Because you are going to reach in the clinical session and the enrolled student certificate is going to be saying, no, please, that's not how the procedure is done. So I make sure that you go through the training to do a clinical session before you go to those schools, because they are better equipped than ours. I don't know how the lecturers are handling that challenge, okay? And you talked about the publications. Yes, we have very many nice nursing researches which are seated on shelves, But recently, the Nurses Council, I think, has started a journal, the Nursing and Midwifery Journal, and Miss Masi Muwema, I think, is among the editors. Actually, I'm reviewing one of their papers. So yes, submit your papers to the Nursing and Midwifery Journal, Uganda, so that we can start peer reviewing them and we get our work published so that it doesn't sit on the shelves. We also have the challenge of the clinical preceptors. I was very proud of Lira University. They have their own clinical instructors, they have their own teaching hospital. You can imagine. So they are not relying on Lira regional referral. And for them, they are getting more ideal things in their teaching hospital. So it is really, I don't know what we are going to do, but I would like to think that Lira people are getting more ideal training. Yeah. And because World Health Organization says it is 1 clinical instructor to 5 students. I remember in our midwifery class, we were 20 with 5 tutors. So we were in 5 groups, and your tutor starts with you from the first class of midwifery, class, ward. But now we have classes of 50 with 1 midwifery lecturer. How are we going to meet this issue of 1 lecturer to 5 students? I think that's a big challenge. I don't know whom we need to address this to, but it's a big challenge, both in private and government universities. And then also I noticed that our students used to benefit from internship. And then recently you see what is happening with internship. The powers that be want to scrap off nursing. So I would like the lecturers and all the policy people to please work on maintaining the internship. And truth be told, internship is not benefiting only the direct students. Internship even helps the completion. Because like for me, I was from the midwifery background. But when you go to the nursing, when you go to surgery, to medicine, you learn all those things. And they help you because when you qualify, they are saying, let's see what the midwife can do on emergency ward. And my first posting after the bachelor's was in emergency ward. But I was ready up to the task. So if there is anyone here that can influence policy, please tell them that we need to maintain the internship. I have already said, please, please, let us not say we are being bachelor prepared and then we leave our roles. I'm going to give one example of receiving patients from recovery ward of theater. That shouldn't be the work of a cleaner, okay? It shouldn't be the work of a cleaner because you're supposed to receive a report and get the last vital observations. But the cleaner cannot do that. Next time a cleaner will bring for you a dead body on the ward. So receiving a patient, for example, from recovery room of theater is a nurse's role. And so I'm telling you, let's not give up our roles. That's why you see people are preferring TBS to us. People are going to FACO because the midwives have not taught them postnatal exercises. They are taking away our jobs, okay? So let's not give out our roles. And I'm saying, kindly, what I have also noticed, when the Ministry of Health brings in protocols, management protocols, they first disseminate to the nurses who work with the Ministry of Health. So I'm calling upon us, if we are to improve practice, we should, as lecturers and students, we should know the current Ministry of Health protocols. Because we have been accused of teaching old things. For example, the midwifery lecturers, have you all rolled out the labor care guides? Lydia, have you all rolled out the labor care guides or you are still talking pathograph? You get? So, as students and lecturers, let us always look out for the new management protocols. Otherwise, I'm humbled to have come here. Please pray for me. I'm also a student hoping to graduate in October. I'm working hard and I know I will get there. Succeed we must for God and my country, and all your other mottos are fitting in. Thank you very much.
Yeah, thank you, sister. May we invite the judges, therefore, to declare the person who is the best and those who are the run-up. And therefore, we shall follow up with the gifts according to that order. Kindly, you can step forward, the chief judge, to announce the winners. And the house, we shall celebrate, but we shall be patient and get our gift as planned.
Look who we are the dreamers, we make it happen, cause we believe it. Look who we are the dreamers, we make it happen, cause we can see it. Here's to the ones that keep the passion, respect, oh yeah. Here's to the ones that can imagine, respect, oh yeah.
who are the national champions, all of us. Good evening, team. All protocol observed.
All your brains to me, and I want to thank you for your active participation in this quiz. I must say it wasn't all that easy, but you've all made it and we have come to the end. So my name is Okiria Julius. Okay, yeah, thank you very much.
Then I have members from the INMSA whom you should really know and their positions.
Luvari Sanon, PRO, thank you.
Protocols observed. My name is Namtebi Jacqueline, Treasurer. Thank you.
Thank you very much. And appreciate in absentia the people who were able to set for you the questions that you were, yes. It's the acknowledgement of their effort. It's what made the day. These include from Leader University, Professor Edward Komakech, from KIU, Mr. Elisa Ndiamhachi. From Agakhan, we had two people, Kirif Aliga and Asimwe John Bosco. And we also have from Barara Kayong Christopher, and also Makerere we had Agnes. So all of Madame Agnes, all of these are the people who were behind the quiz that you attended to do, of course with the HNMU NEC. So we go to the results. Please let's take this serious and we listen. Thank you. According to our performance, Moni University scored 95 points. Victoria University scored 70 points. Oh, they are reminding me of positions. So I will read the positions. So we had also Cabar University with 72.5. We had Lira University with 110. We had Soroti University with 110. We had Makerere University with 110. We had Islamic University with 102.5. We had Busitema University with 105. We had Agakhan University with 100. We had Bishop Stuart University with 95. We had Mbara University with 120. And therefore, I declare the winner, number 1 of the 4th quiz, as Mbarara University of Science and Technology. Thank you, DJ. Congratulations, Mbara University of Science and Technology, for this great achievement and for making nurses proud and for making the profession of nurses proud across the country. I declare Soroti University as the second winner. Then, thank you very much. Thank you, Soroti. Thank you for commitment up to the end. And thank you for making nurses proud. Then, I declare Lida University as the third winner of the fourth quiz.
Tata boy, Papa bless me. Everywhere I go, they say yes I know you. Papa bless.
The University, the Sun, led by the President of Lejo Christopher. Led by members, you dance slowly. Okay. Thank you very much. Sorati University, our first runner. Yeah, they didn't struggle for nothing. Thank you very much. Yeah, and our overall winner, kindly our sisters, our brothers, our neighbors. Yeah, this is it's like BSU has won because you are our corporate neighbors. We belong to one family, Mbarara University of Science and Technology.
Big up bad gal in a real life, nothing that. When the things hotter come like a sprinter, hotter than lava anytime, even in winter.
DJ, I want to run one line, make a line as you come like this. Yes? Please, you come here as 10 participants because I'm seeing you are more than 10. Can I have the participants? The others, you can go out. 10 participants, the first 10. Excuse me, the first 10 participants who participated. The others, you can go back, please. Step down. Step down.
Yeah, once again, congratulations to Must. Yeah, we love you so much, you know. We share a lot. Yeah, thank you, Must, and hope after here we are meeting on word. And I think we shall want to congratulate everyone because this was a real combined effort. Okay, and I would request Must to remain here. Let them not go. We want to finish at once. Thank you, Team Must. I can see the Mr. President is very happy. Maybe, Mr. President, I request you to step forward. President Must, Mr. Tony Twaha, you're highly welcome. No, you just standing here. Yes. And I would also take this great honor yeah, that is team must. Succeed we must. And really it has been a must succeed. Succeed we must or must we succeed? Oh, that is team must. Thank you very much.
The DJ.
Congratulations, congratulations, must. DJ, one song. And make sure you don't overdance on our platform, you understand? Yeah, congratulations. Members, we are not done. Members, kindly take seats. Members, kindly take seats. DJ, members. DJ, must kindly, I beg you take your seats. We shall celebrate later. Kindly take your seats. You go with your trophy and sit with it. No, we shall take the pic after. Members. Okay. In 1 second. 1 second. Already done. 1 second. We are having more gifts. We are not yet done. BSU we give. And by the time we leave, everyone will get a gift. Right? Some got a gift of numbers. Others got a gift of touring a new press. Okay. Thank you. We have other people we are recognizing as the BSU who helped us, who did a great work. We couldn't imagine this function happening without them. And we would like to recognize them. Number 1 is AGNMU, kind General Secretary. I will still request our one. That is AGNMU. Thank you very much. Next, we are having Chairperson INMSA. Kindly take. Chairperson INMSA, kindly step forward. Thank you very much. Chairperson INMSA, kindly step forward. These are the people who have really helped us. Yes, we are having one more person. That is our beloved head of department, BSU. Sister, you're highly welcome. Yeah, it is a great pleasure having you. We couldn't imagine doing it without you. And our very last person is a very precious person. Yeah, he has done a tireless work. That is our patron. Sister, I request that you remain here. That's our patron, Bisunsa, Mr. Kafuko Joshua. Yeah, he has done a very great work. Thank you, sir. We are really humbled. And I'll still take the same opportunity, inviting him, Mr. Patron. Excuse me, sir. I beg that you remain here and hand over to the head of department to give us.
Excuse me, DJ, as the organizing committee, must please listen. Listen. We have prepared some cash for the first runner, the winners. You can come, must. One representative can come. The first winner. Who's that? Must, that is it. Sorati. You go, if you are done, you go. Then the second. Leader, you can step forward. That is Soroti. Leader. Yes, thank you so much for that. Shall we pray as we leave this place? We request that we stand up and have a prayer. Let's pray as we leave this place. We thank you. Let's pray. Heavenly Father, I want to thank you for this day. We thank you that you have been with us the 2 days that we have been together. We thank you for the opportunity that we have been here to assemble together, to interact, learn, and share experiences. And above all, we thank you for our good health. We thank you for the partnership of different universities and our stakeholders. We thank you for Bishop Stuart University that chose to take on the honors that has become a success this evening. We want to acknowledge your presence amidst us, and we pray, God, that may you continue to use us and take us the direction that you want us to go. Above all, we want to pray as we part from each other. May we part physically, but we remain in spirit above all, because we know you, Lord, yourself, you are spirit. Go ahead of every situation. Those who are traveling, we said you are the driver. May you continue to be with us, because you promised that we are 023. INMSA agree in a prayer shall grant our prayers. We believe, God, that you hear. You've been with us, and we continue to be with us, because you promised that you never leave us. Whether deep flames of fire or water, you shall always be with us. May you stretch your hand to be the driver, cover us with the precious blood of Jesus, such that when we go back home and meet our beloved one, our respective universities, we shall glorify your name. We want to thank you for whoever has been here. May this time that has been invested here be fruitful, and may you bless each one of us. As we say that you ask, you shall find. May you bless each one of us, Lord, as we go out to serve you. Continue to minister to each other. In the name of the Father, the Son, and the Holy Spirit. Wish your neighbor peace as we get out of this place.
Thank you.